What's
All right.
up, everybody?
So,
Future Cannabis Project in the house. Um, yeah, so me and Peter just catch everybody up. Me and Peter were kind of chatting about, show topics and stuff. We typically will do this prior or after the show. And Peter had a guy
and then
lined
we'll
up for
flake
today.
out,
And
and then we'll scramble last minute.
yeah. Yeah. So we had kind of a lineup for today and, technical difficulties in everybody's schedule. So we're kind of talking about, future shows, today's show. And one of the things that came up is next Friday, I was chatting with Charles Stocksdale, the guy, part of the crew that found that skunk. And there's some stuff that happened like some stuff that was said when we had Kevin on and all the ganjiers that went down there and all the other people that went down there. One of the things, because I've kind of been in touch with them since then, and like Peter was saying before the show, like the issue is they all went down there and they straight up, like Kev straight up said, this doesn't smell like skunk. It was like a chemi kind of smell. And supposedly that was a result of them speed drying a little bit and they lost some stuff. So Kev was talking about, how the finishing of anything is going to influence its expression. But that's just one part. So this is the thing that I've kind of been hung up on lately because I've not experienced it. So I've been really, really curious about it. And the skunk smell. So everything that falls into this realm of skunk, there's essentially 4 check boxes that you have to hit in order to get skunk. Obviously, one that everybody is the most familiar with is that roadkill smell. That putrid, acrid, sulfury skunk spray. So there's that. That's one. The other one is the intensity of the aroma. So this is something that it has to absolutely smell through the jar. And it has to be so loud that you can essentially pick it up through barriers, jar, wall, box, whatever, right? So that's 2. The third one is its ability to stick, right? So
Actually, just quickly, Travis, since you were there, you want to jump on with us?
yes, please. So that's the other thing is it's got to stick. So
No one's getting the cut. What?
not yet
I think
anyway.
that's their whole point, right?
Yeah, so that is the whole point.
So weird.
So and I'll get to that too. I'll kind of get to that. So we've got the smell, we've got the intensity of the smell, and we've got this longevity, like it sticks. What was the 4th one? Maybe I added one.
Every time I put a message on the screen, I don't mean to switch who's big. I don't know why it keeps doing that, but
okay, so this is where I'm curious because I wasn't there.
Interesting.
So that was kind of the thing Kev said was that it was more like what they had was more Kimmy. I wish I had been down there. I kind of put the bug in Charles and Kev's ear to come out and smoke some with me just so I can get a reference for myself. But it's driving me nuts that I can't remember what that 4th one was. There was something else. So essentially we have...
Well, Travis was talking about the resonance.
That's that stickiness. How like whether you smoke it or not, the smell just sticks to your clothes. It sticks to everything. So that was it. Okay, so the skunk smell, the loudness, its ability to penetrate, and then the resonance. Thank you. So it was those 4 things that have to come into play to make skunk. And I would imagine the latter 3 are the most important. It's got to be loud. It's got to penetrate, and it's got to have this resonance to it. The skunk part is going to depend on environment. It's going to depend on how you dried. After talking to Dude, he hunted it under high pressure sodium. So that's the other part. I'm like, if I throw this under LED, does all that aroma go away? Is it completely changed profile? Does that lose intensity? So then it comes down to it's an epigenetic switch that you have to figure out which ones to turn on, which makes me wonder are those latter 3 things present in more than what we know? So Travis, you were there.
Just quickly, the starting point of all of this was me still scratching my head, being like, if everybody's tired of hearing the skunk has been found, right? And,
yeah,
and then have and so if you're like, and if you're like, we found it, and then you bring everyone together, and it's not skunk, but the rationale is, well, because we had to unfortunately, we had to dry it, or like, we had to do something differently than we would normally do to get that skunky smell we've been telling everyone about. In my head, I'm like, why would you not do whatever you needed to do? Like, postpone the get together by 2 weeks or whatever it is.
Here's first things first. There's some country folk. They're not close to heady. I don't know how to describe it. It's like they don't give a shit about all that, you know. Like,
fair enough. Yeah.
So
that wasn't hit. What's his name again? The guy the father.
I can't recall off the top of my head, but I think their concern was just to get it dry enough to smoke. Like most of us would think through a lot of our lives. Like, I don't know, it's still like the old days. It's like, oh shit, people are coming. It's got to dry. Let's lower the humidity like crazy and raise the temperature up to 80. And let's see if it'll burn tomorrow. It's almost like putting bud in the oven or the microwave. It's like, it was by far the best expression. But imagine you're 13 or that's a horrible age. Imagine you're 18 and you just want to get stoned because you don't have anything. You throw that shit in the oven if it's wet, you know? It's like that mentality.
Yeah. Right. So what was your take just out there on the nose, on the flavor? What was your
I wouldn't call it skunk in the least. Like, my test was when I walk up to the house and park my car, I should smell it. If I walk into the house and don't smell it, that's another check mark in the negative. If I get near the jar and it's not opened, I should be able to smell it, and it didn't. It was like you really had to like kind of get in there. But regardless that it wasn't skunk, I do think it was some of the most special products that I've ever seen in my life. So I don't think, at least from what I saw, I wouldn't dawn it skunk. I would call it Chem D plus. Like, to me, that's definitely what it was. It was to 11. Yeah, it was like Chem D, but where maybe Chem D has a lot of more single notes and not too much complexity. Like, it's just, you know, straight gas like people like. This one was like that with so many other nuances that are hard to describe because they're not like any other genetics that I've tried or even like smells in nature or the kitchen that I can describe. It was just super complex. There was levels on levels on levels. And I can imagine if it was dried and aged a little cooler and a little lower humidity, I could see it being some of the best flower ever, even if it wasn't skunky.
Okay. So that that actually shine some light on some stuff Kev said too, when it comes down to, we need to do more testing on this. And I think that comes down to, I think in his perspective, everything you said, I think he's kind of expressed to me.
It seemed like our assessments were almost spot on. He thought it was Chem D plus before I knew that. Like,
so it's this really unique expression of Chem.
Yeah, without being influenced by his opinion. We said the same thing on the flower and the rosin. I was like, this smells like Chem D plus. The rosin smells like raw cocaine.
Oh.
And it was like we both kind of had those, like, you know, we didn't suggest it. No one suggested it, but that's exactly what I smelled.
Okay, so it just, like I said, that kind of shines a light on some stuff because Kev mentioned wanting to do some testing. And I think that's because he wants to see if this is present at whatever it is. I think he's more curious on what made this Chem so special. And some of the, I'm really shitty about lineage and history, especially stuff that predates, you know, early 2000s, even like I would say early like 2010, right? I was only a decade in and I didn't really have a whole lot of reference points to some of those varieties that came out in the mid 90s. But the rumor is Chem and Sour were both created with this super skunk, and that super skunk supposedly is where the skunk's at. So there's this correlation between Chem and Sour and that skunk that I can't seem to let go of in this like journey of whatever the hell we're in. So that was part of the reason, just kind of kept everybody. That was part of the reason why I was thinking about bringing Charles back on, is because I wanted to see where this, whether it's skunk or not, I wanted to see the history on where this 87 skunk seed pack came from. Because they're calling it 87 skunk number 1. From everything I understand, skunk number 1 was a sweeter variety, and it really wasn't skunky. It was more like the Exodus cheese, the UK cheese, whatever you want to call it. Cheese supposedly has some of that like skunk. So I'm just curious where this is going to land in the world of cheese, sour, and Kev. And for me,
also with a proper dry and cure, like I just
so that's the other part.
I just want to take a step back, have them take the time to do it how they would properly do it, no rush, no outside pressure, then smoke it. But I do like, you know, Kevin wanting to test to see, like, does this have any like singularly unique terpene chemistry, like chemotype expression that is just cool, right? Like,
yeah,
it's a great smoke. It's awesome. It's unique, right? It is unique. So my two questions are, or the two things, one, can in your next harvest, which is however many months out, just do it however you had been doing it, or like, is there anybody who had smoked it prior to that get together who was like, yeah, I smoked it the last time they harvested it and it did have that skunky whatever?
Right.
I do trust Kevin's assessment of the empty box, though.
So that's what has my curiosity.
If the empty box had the power of, it had that powerful of an aroma, it almost guarantees to me that the genetic potential is there. It's just not what the crew up at the house got to see.
Exactly. Which leads back to what Peter was saying, like, take the time to make this the way it was when you sent it to Kev. And again, that's what got me excited, because I posted a thing on Facebook. I was like, Colorado still doesn't smell like skunk. And I told Charles he needs to fix that. Well, he reposted that, told Kev they need to take a trip out to Colorado. So I'm hoping they can show up with a little sample and I can get, you know, me and a bunch of Colorado buddies together and see what this is all about. And it's not in the, I mean, with anything scientific, you have to maintain this non-biased type skeptical mentality. And I think there's a professional way to express that. And that's what I'm curious about, because is kind of excited as I am about this, I maintain the same level of skepticism that everybody has that hasn't gone out. The fact that, Travis, you went out there and you're like, the loud doesn't check the box, the resonance doesn't check the box, and the penetration doesn't check the box. That to me is 3 of the 4 boxes that absolutely need to be checked. So I'm really curious, like, it just has
So I'll say this as far as the producers. I don't know them that well or intimately at all, but the impression that I got spending some time with it, I don't think they would really care if the next batch came out how we wanted it, as much as it came out how their patients wanted it, and as long as it still got you ripping stone, because it works.
And they don't seem like they're pounding their chests.
And they never called it skunk. It's been called by them 24/7 for years. So to them, I think the skunk narrative is almost getting attached onto what they're doing more than that's their goal. Like, I don't know them that well, but I don't think they really give a fuck if everyone thinks it's skunk. You know?
No, I agree. I think they're just growing weed they enjoy and their friends enjoy, and someone from the outside smoked it and was like, this is you. I think they know it's uniquely special. My only thing is, before we keep having like skunk conversation after skunk conversation after skunk conversation, it's like, if we want to keep having that conversation, like, let these guys grow, like, take our time, let them grow it out again how they would find, however it expresses how they normally express it, and then we'll enjoy it for what it is.
Well, and that was one of the things Kev was talking about, like, developing an SOP to get that, right? Like, that was, I remember Kevin said that when he was on the podcast, like, that was part of their goal, is to develop an SOP that would consistently get that expression. What was that comment? Was it talking about Caleb Chen?
Yeah, you could tell by Caleb's or expression that it wasn't everything that he flew out to.
Again, on the thought, I think giving this crew standardized SOPs is a difficult task.
Oh yeah, 100%.
They're using whatever single-ended Hortilux bulbs they can find, and it's like, how are you going to start an SOP with equipment that you cannot purchase or get new anymore? It's like, it's just chaos. You know, whatever bulbs they have, they're screwing in. They got piles of them, old ones, semi-new ones. So to me, that's a hard goal when there's so much chaos in the environmental variables.
Oh, 100%.
And I think it's kind of like, from what I was talking to them, it's kind of like an exhausted ventilation system. So season to season is going to be, especially up here, from going from 90 in the summer to 0 in the winter, there's going to be a lot of
I was going to say, if they're running a passive or like a negative pressure type vibe in their room, yeah, they're going to have massive just environmental swings. But I think that's the key, though, is like, if we can, and that's kind of what I've been on about. I'm like, how do we get this into an R&D system? Because, like, just to see if this even shows up under an LED system, right? And then to stick it in a sealed room and go, okay, this is the temperature, humidity when you first pulled this, and everybody's in love and all this, like, that needs to be maintained. So we need to figure out what, there's just a lot of R&D that's going to go in. And it's one of the things that has me so curious, is because I'm just like, to me, even the structure of the plant seems newer. I don't know if that makes sense, but I've seen like pictures of colas and branches, and it seems like something that was recently created. It doesn't look like how I would picture something from 1987 looking like. But there's all these, that's what I say, there's all these things that kind of have my curiosity piqued, and I myself can't let it go, because
I think that's the case with I think everyone else is much more interested than they are. Like, if that makes sense.
Yeah, I agree.
Yeah, same.
That's why I said I'm not saying in any way that I think these guys are pounding their chest, being like, no, we have the skunk. No, not at all.
They call it 24/7 because it always works.
They call it what?
24/7. Like, that's what it's been called for 15 years. It's been called 24/7. So think of that.
Oh, he's had that for that long.
For 15 years, no one's ever called it skunk. They've been growing it for a minute. I think they have their SOPs dialed in how they want them. Maybe not how we would prefer them, but I don't know. I think they got it.
Okay. That helps a lot, actually, Travis.
And if only we had a chemist who could break down all these volatile organic compounds. What's up, Del?
What's up?
How are you?
Good, thank you. How are you?
I'm good. It's been a minute. Are you up in the Bay Area, or where are you?
Southern California.
What? You're down by me?
Yeah.
How southern?
Out near Palm Springs.
Okay. Inland.
Usually I'm in the Bay Area.
Okay. Like, are you visiting, or you moved there?
Wow. Yeah, weird delay.
Oh, really? Do you? You know what? You might have the Facebook tab open still. Did you kill the Facebook tab?
That's what it is. Hang on.
There we go. I'm a pro when it comes to technical troubleshooting of streaming.
There we go.
Issues.
I think we got it.
So is this the original guest we had planned for today, Peter?
It is.
All right.
It's Del.
How do you do?
The funky Homo sapien.
Yeah.
Good to meet you guys.
Nice to meet you too,
so
brother.
you for a lot of reasons popped up in my radar again, but we had been talking, Jeff, I'm specifically thinking with was it Kelly?
It started with Bruce and then it was Kelly.
Yeah, so with Kelly we were talking ingesting, like, basically we had all sorts of like body chemistry questions, right? And like theories and ideas.
Yeah, so
Sure.
Kelly was
Most of
talking
them,
about try basically this type of compound that is sunflower oil. And he's using CBD. So basically he goes through the typical decarb process of making like an oil with the CBD flower. But he's saying that the sunflower oil bypasses your stomach and your liver, gets absorbed through your intestine, goes to your lymph nodes. I think he was calling them triglycerides or something like that.
No. It goes through regular GI digestion. You know, the only way you can really bypass stomach acids and get into the duodenum, the upper part of the intestine, and once you get in there, you only have a 3-hour window before it moves out of that range. It's a type of delivery called enteric delivery, where you have, let's say, a capsule that's coated with a substance that prevents its dissolution in stomach acid. It goes into the duodenum, and at that point, it usually has a very specific pH on the outside of the capsule that is the point at which it dissolves. And that pH is very specific to a region in the duodenum. And that's really the only way you can get it through stomach acids and into like the vascular surface of the mucosa in the upper intestine. It is a pretty cool way to deliver drugs because there's a tremendous vascular surface there, and the spaces between the interstitial spaces in the mucosa are much larger, and it's easier to get larger drugs through with lymphatic transport. So, you know, if you're talking, you know, how do we deliver it? That would be, you know, how you can bypass stomach acids. Normally, sunflower oil just gets metabolized like any other oil. You know, boom,
Okay.
you know.
I get. Well, that was going to be my next question. Kind of, if you had to like rate different oils as making things bioavailable, is it one of the better ones? Like, what would you reach for?
Oh, you know, I'd put it.
Front?
I would suggest that, you know, if you're trying to get something that's, you know, hydrophobic into solution, just about any oil will do the trick. You know, I'm not sure that the differences between them are pretty negligible. What you want really is, you're trying to get the cannabis oil dissolved into the other oil so that it has more of a broad uptake. Cannabis oil is notoriously difficult to digest and notoriously difficult to solubilize. Generally speaking, the strategy I think most people use now is a nano emulsion, which, you know, you break it into small particles. You use emulsifiers to distribute it through liquid, usually water, and the emulsification process really allows it to be solubilized, but it doesn't even last for a very long time. It lasts for a brief period of time. And usually then, I mean, a lot of people have different tech, but it starts to separate after a while.
Okay.
And form like a little layer on top.
Yeah. Okay. There was, I'm trying to think. And I wish I would have copied it and been able to share it, but I didn't even think.
I wish he was here. He would explain it pretty.
Why you want to text him? You want to text him and see if he's around?
I can see. Yeah. Because he was one of the things that he referred to this study that was done, and
I like studies.
Right, and they had done this thing with sunflower oil and CBD, and I think the CBD was grown in yeast. But the study showed that whatever they were doing, it was helping with, I think the study was on MS.
Right.
And they were somehow, because MS is an autoimmune disease, and somehow this combination of CBD and sunflower oil was affecting the autoimmune diseases. And that had to do with getting into the lymphatic system, whatever that means. And then
yeah, I mean, basically that's how it would transport into your system for sure.
Right. So he was explaining he is having the same thing, the same experience with his rheumatoid arthritis, because that's another autoimmune disease. Does it matter? And I don't know if you're an endocannabinoid specialist or not, but does it matter? Like, does it have to, like, stomach acids and going through your liver still distribute it to your lymphatic system, or is like
the first thing that happens is you know, if we're just talking CBD, it breaks down to the metabolite of CBD, which as I recall is 11-hydroxy CBD, and that is, as with THC, is a stronger version of the original. In other words, it breaks down to a much stronger form, and you know, the real question, I think, is, you know, for the particular indication you're trying to target, you know, what's the mechanism of action that CBD might bring to that? And in the case of MS, you know, I don't know enough about it to really say. I just recently wrote a paper on my Substack covering using cannabinoids with peptides. The peptides can enhance the therapeutic effect of cannabinoids in many cases, and be complementary, increase uptake, all the things you're looking for. But you know, I'm not, you know, off the top of my head, I don't have the research on MS to be able to say exactly what the mechanism is for CBD.
Does anyone in the chat remember the study? Because I Googled it. There are a couple different studies that popped up, so I wanted to pull the right one. But I mean, yeah, I mean, we've been, for the past couple weeks, taught, like, Jeff has seizures, and Kelly, like, talking about, you know, obviously the like, personalized medicine nature of, like, what I've always loved about kind of cannabis and patients is, unlike kind of the pharma industry, which is a very top-down, like, you know, you have to have billions of dollars to even bring something through a study. It's typically a single molecule. And then, like, in the cannabis world, it's been thousands of caregivers in these little silos of, you know, doing their own thing with their own patients and making discoveries about, like, holy shit, like, this worked on someone with seizures. And, like, oh my God, I tried the next person who had seizures. I tried the same thing and it worked. And, like, the next person, it worked. And then the next person, it didn't work. But then, you know, I found something that worked for them. And lo and behold, like, I'm seeing bell curves of efficacy of, you know, chemotypical expressions that help certain conditions. And then we were talking about, like, but then you have the different form factors of delivery where Jeff may be trying to work on his own health, and he may try a plant in with one type of delivery, like I smoked it, or I took it, you know, I processed it through my liver, and it didn't work for him, but had he tried it another way, maybe it would have worked. So it's interesting to see, like, it was kind of part of our conversation was the importance of all these kind of grassroots caretakers documenting stuff and then sharing and learning and trading ideas, and just kind of to me it's a cool way to find things that work for people versus, like, our very rigid FDA system. I mean, obviously there are pluses and minuses, but I like the kind of ground up caretaker explorations that have happened over the past 30 years.
Well, you know, if there's one area that, you know, cannabis therapeutics and pharmaceuticals have really shown major effect, it's in the area of seizures and in the area of, that type of inflammatory process. And, heck, it seems to work better than the original conventional drugs that are out there. Uh, you know, I just, for most people, I think that Sativex, the THC CBD combo, that's the pharma approved version, is approved in many countries for like MS spasticity. So cannabinoids really help symptomatically, but does it really help slow the progression of it? Uh, you know, that's where I started thinking it might be useful to combine it with certain peptides like Copaxone, which is a peptide polymer that alters immune responses and is sort of a mainstay of MS treatment. So you have these combination approaches where you have the CBD lowering inflammation and the Copaxone, which is a biological peptide. It's something we produce. It's like 4 amino acids. It tends to alter the immune response. So the Copaxone induces anti-inflammatory cytokines locally, and then the cannabinoids act on the same immune cells to push them further into a regulatory type phenotype. So patients, I think, would respond to a combination therapy better. But to your point about data and how we get data, there's several layers of data. You mentioned people going out and getting anecdotal data. Certainly that's one whole level. And one whole level are clinical trials. One whole level is real world data, that it's a little more systematic collection of anecdotal data. The way I look at it is you want to use all these different layers of data to really come to a conclusion. We know notoriously, my friend uses it, so, maybe it works. One person, not so much. When we start getting aggregate data of like many people use it, and many people begin to see an outcome, it becomes more compelling.
So that bell
but I
curve
just feel
that Peter was talking about is essentially the start to that process. When you go, okay, we've got one
it's the start
individual,
to that
multiple
process.
individuals. Now let's start looking deeper.
Yeah, and I wouldn't say, like each level of data is valuable, and each layer of data has its own pros and cons. But the other question that it kind of brings up is the way pharma kind of silos the data and the treatments. Like for 10,000 years, people have been using cannabis, to treat, likely before it was even recognized as a treatment for seizures, people were using it. And along comes pharma, they come up with Sativex, which is the THC CBD combination, and suddenly the FDA has prior art. So now anybody who wants to use it has to either license or pay or somehow recognize that this IP exists. The FDA creates this regulatory framework where you get a runway of exclusivity after you get a new drug through clinical trials. And what that does essentially is it captures and silos, not only the data, but the drug itself. So now, nobody can use it unless they either pay a fee or recognize this other IP. I'm really advocate, and I think this is about to happen really with whole plant formulations in cannabis. Like we're about to see, with this move to Schedule 3, a huge rush by pharma to capture whole plant formulations. We're not sure exactly what it might be in those whole plant formulations that's effective, but they want to cast a broad net and capture it basically. So I've been working on this project that's kind of a, nonprofit approach where, the public actually, a public organization pushes through a whole plant formulation through the FDA and makes it open source and available to anybody. We saw this kind of happen in psychedelics. Compass Pathways came along and said, "Hey, we have this proprietary version of psilocybin, Comp 360," and they started doing trials on it for treatment-resistant depression. Usona Institute came along, a nonprofit, and said, "Wait a minute, psilocybin's been available forever. You can't just, isolate it in that sense." So they started doing trials with plain old psilocybin in parallel. And so now we have these two competing pathways forward, one in the public domain that allows people to use it inexpensively, and the other sort of captured and siloed by big pharma that's going to charge a lot of money for it. I'd like to see that same thing happen in cannabis.
And these are you're talking about synthesized compounds, right?
But
well, generally speaking, the way it starts out, like Sativex originally, they tried to breed plants that would more or less produce 50% THC, 50% CBD, and it just became unwieldy to try and do it. It was just too tough for them. So they ended up just saying, okay,
1-to-1.
Yeah, just a pure 1-to-1 hybrid. And they ended up just saying, "Hey, this is just too difficult to manage," and so ended up going to an extract. Now, that doesn't necessarily mean that it has to be a synthetic extract. It can be, a botanically derived extract. The FDA has rules about using botanicals. Botanicals can be used, can be sort of, isolated and patented as drugs.
Well, and they did that they started off with a CBD version, like a synthetic CBD version. And I think there was a study done on rats or mice where they were finding like crystallized livers. Well, Terry had mentioned that too, and he was saying that when you have this accumulation of CBD in your liver, it inhibits your liver's ability to process toxins coming through. Have you heard anything?
I haven't heard about that study. Generally speaking,
did you
once
text
we
Kelly?
get down to
I did. I texted him and sent him the link and said to pop on if he has a chance.
Oh, you know who we're talking about.
So
you know Kelly?
Do I know him?
Yeah.
Yeah.
Oh.
For sure.
I didn't know that.
Oh yeah.
Why wouldn't they, Peter?
No, for sure.
Who knew?
Yeah. Real well. So generally speaking, by the time you get down to the molecular level, there's very little difference between, the botanically derived version and a synthetic version. Where differences come in may be in minor cannabinoids and terpenes and the other constituents of the plant that might be in a whole plant extract. But, I don't know about that study. There's a lot of notions about.
I think this is the idea.
Synthetic.
Do you see that comment?
Certain enzyme, and I think that's what he was saying. I think, and
I always like people to give me the link to the study.
Yeah. No,
sometimes it's a matter of interpretation. Exactly what's being said.
And I'm telling you, if people know the right words to say, I can't tell if it's anecdotal or if they picked it up from something they read.
Yeah.
Let me
heard,
just,
or.
Can I just stop on something? And I just want to make sure I'm understanding you correctly, which is kind of the way I've always thought about it. Like, on Instagram and LinkedIn, Jade Nectar Jeff Nordahl has been posting a lot about kind of anti patent, it's a plant, it's a spirit plant, it shouldn't be patented. But to me, the counter argument to that isn't that I'm passionate about patenting plants. It's that cannabis is coming on to like the the agriculture freeway of how agriculture works globally. And in that world, a Monsanto creates Frankencorn and then has patent lawyers proactively suing farmers who they send their pollen out to rape my plants and then sue me when my plants have babies and I grow those babies out, right? And so it seems like what you're talking about on your, essentially, I don't know what the word, public benefit corporation or like this public entity is getting patent like protection, but then making it free to the world so that some asshole can't come in and patent it, where everybody's like, dude, you're just trying to patent.
But those patents,
magic
Peter,
mushrooms?
I think are on combinations of compounds, not necessarily.
Well, they can be.
The
It depends, genetic patenting can be part of it. But I'm not, broadly, most people fought for cannabis legalization. The goal was access, access to a plant that for many people relieved pain, reduced seizures, eased anxiety, made sleep easier, and made life more livable. It was all about access. Now cannabis gets descheduled. Research is easier. Doctors feel safer about it. But this is also the most dangerous moment because legalization does not automatically mean access. Medicalization, if left unchecked, often means just the opposite. Essentially, cannabis gets pulled into the system that has turned countless natural medicines into expensive, tightly controlled products. It's almost like it's not through conspiracy or any kind of malice. It's just routine process through paperwork, through legitimacy. And when it becomes medicine in the eyes of regulators, it doesn't simply get validated, it gets translated. And in that translation, the control changes hands. Cannabis itself can't be patented. No one can own the plant, but modern pharmaceutical systems don't need to own the plant. They just need to own a version of it, as you pointed out, a standardized preparation, a specific ratio, like a full spectrum formulation approved for a particular medical condition. Sometimes this can be tied to a delivery, like an orally dissolving tablet or an oral thin film or the enteric capsule that I described. So a full spectrum formulation approved for a particular medical condition. Once that happens, the real medicine is no longer the plant, it's the one that carries the official permission. So that's the concern. And we saw it with Epidiolex. Epidiolex entered the market with a list price exceeding $30,000 a year. And then access became dependent on insurance coverage and bureaucratic approval. And non-pharmaceutical cannabis treatments, even when they worked, were suddenly treated kind of second class. And so I see the same thing happening right now with descheduling. There are already companies moving on, a regulatory path using whole plant cannabis formulations and positioning full spectrum cannabis as a prescription.
So I guess that's what scares me is the fact that if they, even though they can't patent the plant, if they essentially find a plant that already produces the compounds and the combination they want after
like
all their
chemotypical expression.
Yeah,
right?
and they go, we patent this combination of compounds, and now if you're growing anything that comes close to that within a percentage, right, they're going to say, you can't grow that anymore. So they're not directively patenting a plant, but it's like a loop around into.
Generally speaking, it's going to be, according to pharmaceutical standards and likely, either synthetic or an extracted. Just for example, again, the same example in psychedelics, what's their name? Compass Pathways came along and they said, look, we know we can't patent psilocybin, but we can tweak it just a little bit and make it into our version of psilocybin, and that we can patent. And now suddenly that's what's moving through clinical trials, and that's what's going to, go out to doctors. And if you try to fill a prescription, it's going to be Comp 360. And certainly the same thing can happen with cannabis.
Do you think that the term medical cannabis is going to get shifted to all the pharmaceutical, and then anybody else using it holistically from the plant is just going to be considered a rec user?
Yeah, without doubt. Because that's exactly how it works. Medical becomes, what this descheduling did was it essentially said, okay, pharmaceuticals go to the FDA. That's who supervises our pharmaceuticals. And curiously, cannabis has been serving millions of people. It intersects with pain, epilepsy, all these different things, multiple sclerosis. But once that formulation gets approved, you're not, anything outside of that is non-medical. It's got to be. And so that's the concern, I think, really. So I've been trying to get momentum behind this idea. Hey, let's all contribute to this. Let's the community all contribute to this. Let's own the whole plant formulation. Let's push a version through. Now, myself personally, smoking has never been a pharma delivery. That'll never work. There's too many health consequences associated with smoking. The delivery is variable. You take a big hit, you take a little hit. Who knows what exactly the dosage was? So it's likely what we would have to do in the public domain is use a delivery like either an orally dissolving tablet or an oral thin film or an enteric capsule. I'm willing to lend my expertise to try and put together that formulation and delivery model, but using whole plant cannabis formulation, a full spectrum formulation.
And the only thing I know of right now that's Mojo Botanicals, I think they have a rosin product that's orally dissolvable. Like you just eat it. And they're the only ones that have anything like that from what I've seen so far. And I think it sounds like what you're describing is something like that, maybe in a pressed tablet form or, pill form or something.
It's not difficult, to get cannabis, in orally. You nanoparticularize it, you emulsify it, and boom, it's much more soluble. It's much more bioavailable. And we could argue that, that bioavailability is an advantage. People smoke and there's this tremendous vascular surface in your lungs, but it's got health consequences, right? At the end of the day, that's never going to be a pharma type delivery. It's going to have to be something like an orally dissolving tablet, whether or not it's composed of rosin or whether it's an extract that is a whole plant extract. Could be everything in a given strain or a given variety, rather. So,
well, and I think that people are, I'm open to that possibility. Like I would probably smoke in the sense of enjoyment. So it would absolutely be a recreational thing. But to take that into consideration I just took this pill that is consistent in its dosing and its time release. So just like some of my epilepsy medication, I take at the same time every day, twice a day. And it serves, and then cannabis is like short relief between that, if that makes sense. And that's
you're trying to get one of the things you're trying to do is address the episodic effect. You want to have, okay, look, I've got a problem coming up. I want a very rapid onset, very rapid delivery. One other area that I've been working in is creating a water soluble formula that's nebulized. So just imagine a device that has a hypersonic plate in it, and it vibrates to the point where it reduces water molecules to a fine, super fine mist, like a vape pen, right? And contained in that superfine mist are cannabinoids. It's a little more difficult to get terpenes in there. I will tell you that right now, but you could use a pretty broad spectrum of cannabinoids, and you inhale it, it coats the surface of your lungs, it leaves no residue. It's metabolized, it goes into your system. We get an onset that is comparable to smoking without combustion or the health consequences associated with it. So you're looking for that rapid onset. There's ways to achieve it that is definitely similar to smoking that can work.
Sorry, I'm just
You know,
showing the.
so like you said, you know, it may be a combination of things. We may need a systemic delivery that's sort of a longer lasting one, and you can do that too. What you do is
that's kind of the key, at least in, and I'm just speaking from my perspective. I need something that's going to increase what's my seizure threshold, right? So think of it like a high jump bar, and every little thing lowers that bar, lowers that. So I need something to keep that bar high. And then when I feel like, oh, like you said, episodic, I need something that's fast. And anything, and right now the fastest is combustion. So you're talking about something that essentially vibrates so fast it makes the particles small enough to float in the air, and you're still inhaling it.
Exactly. And then you're just inhaling it, and you're using that broad vascular surface in the lungs for absorption, but you're reducing the health consequences. And you're using excipients that are easily absorbed and metabolizable and don't leave a residue. There's other ways to do controlled delivery as well. Okay, let's say we break cannabis, CBD, THC into these nanoparticles. You can coat them with a fatty layer liposome. And this is a standard type of controlled release in pharmaceutical drug development. You coat that particle, then it takes a minute for your body to actually work its way through that fatty coating to get to the particle. And you can make that coating various thicknesses. So let's say some go into your system immediately, but others take a while to metabolize. So you get a plateau, we call it the Cmax curve, where instead of a spike, it's more of a constant signaling plateau where the stuff releases gradually. So you can do it that way. So, you know, you could have an enteric capsule delivered, goes into your lower intestine, upper part of the intestine, adheres kind of to the side of the intestine, bleeds the compounds through. They're encased in liposomes. Some of them go into your system immediately. Some of them are time release and enter your system more slowly.
Could you see something like an EpiPen working where it's like, oh my God, they're going into a seizure, bam?
Well, you know, subcutaneous injection always works. You know, that injectable formulations, you know, I always try to work around that because, you know, I hate needles, you know, honestly. But yeah, right now, you know,
but even being like you can't do that with a whole plant material, right? You'd have to use some kind of hydrocarbon solvent to make that stable and transportable.
Well, you would likely, but you know, generally speaking, like when I did hydrocarbon type extracts or ethanol extracts, the goal is to get down to 0 parts per million residual solvent. You don't want to leave any solvent behind, you know. So you end up with, I mean, that's just for SOPs from my perspective. You want to end up with something that has absolutely 0 residual solvent. So, you know, you can work that way. Yeah, but likely that's going to be the most efficient way to do it. So, you know, when we say full spectrum, you know, what are the most difficult things to kind of add to this mix for a rapid onset generally is terpenes, but it's not difficult to look at what the profile of a full spectrum cannabis formulation is, all the minor cannabinoids, all the terpenoid compounds, and represent those in a
and all the stuff we don't even know about yet. Like that's the other half, is there's so much about the plant we have no clue about. And we were kind of talking about that before you jumped on. Like, there's this version of chem that seems to be really, really special, and we don't know what makes it special.
That's really interesting because, like, I don't know if you've heard of like THCP and CBDP. In laboratory preclinical studies with rats, they end up saying that it has 30 times the agonism of THC. So it's like basically theoretically 30 times as strong. We didn't even know about it until these Italian scientists.
I didn't even know about it till today.
Italian scientists, for one reason or another, Italy believes that soldiers should have access to cannabis to relax, to calm down. It's just part of the deal. So they have been, looking at a lot of different phenotypes, and just by virtue of supplying the Italian army with a 50-50 kind of 1-to-1 ratio product. And these Italian scientists started looking over all the phenotypes that they were using, and they discovered THCP and CBDP, which is also a version of CBD that's way stronger. There hasn't been a lot of clinical trials with it yet, but there's something we didn't know about until not that long ago.
All right, we're on the hunt for high THCP cannabis.
Oh my gosh! Can you imagine 30 times?
I bet as everybody was looking at the stuff I was highlighting, they were like, "This sounds amazing. It makes you even more high and longer lasting."
Well, that goes on to like what Hoku was doing with CBG. Like I've heard about it, but not a lot. And then I'm like, oh my God, this one compound essentially increases efficacy of all the other compounds. And then I have to give a shout out. I have to give a shout out to all the breeders that we've been interviewing and chatting with, because it kind of gave me a little bit of pleasure to hear about these scientists that were shooting for a consistent 50-50 ratio, and they couldn't do it and they gave up. And we've got guys in the trenches like still working on stuff like that. So shout out to them.
Yeah. But the thing is, in pharma, it's likely going to be an extract, and it's like what combination. And the reason we don't know about a lot of the stuff is because research has been so restricted. If you have a Schedule 1 product, you have to be specially licensed to work with it. There has to be a chain of custody. It gets very difficult. It gets more difficult to conduct research. And if it is deschedulized, then there is the opportunity for more research. We'll find out more stuff about it, but we're going to have to see some real signals that, that all that's worthwhile. And that comes from the anecdotal reports.
What, can you talk? I mean, can you just?
I thought we were going to talk about cocaine.
Yeah, I'm ready.
I was gonna say we're leading into that. We had to warm you up a little bit.
We're just getting started, but this stuff's interesting too. All right, yeah, we can skip along to cocaine. I was gonna ask, like, if you just kind of like riffed on different cannabinoids and like interesting research tidbits you've read, like what's cool about CBG, THCP, like THCV, like what are you digging in the cannabinoid world that you find interesting?
I still think THCV is quite interesting because the way it works is it's a partial agonist at the CB1 site. So in other words, what it does is it occupies the site but doesn't fully engage. Why is this interesting? Because the CB1 site has been shown to strongly influence appetite. And Big Pharma came out with a version called Rimamabant, which would completely agonize CB1, and people lost their appetite completely. But they also wanted to commit suicide. So it was pulled from the market caused extreme depression, suicidal thoughts, all this stuff. So I've always felt like there is an interesting possible line of research that might see using THCV as a partial agonist to reduce appetite, maybe in conjunction with GLP-1s, maybe on its own, and being able to be used in combination with CBD to reduce appetite as a treatment for metabolic disorder and obesity. So that's interesting. On the other fronts, we haven't really seen the promise that was represented with cannabinoids in oncology. Everybody has always been looking for, heard these anecdotal stories about, cannabinoids being able to cure cancer, whether it's a full spectrum type formulation or stuff like that. That hasn't really shown up in the research yet. Whether or not we're doing it right, but people, it just hasn't shown up yet in the research that's been done. It does tend to alleviate a lot of the symptoms associated with chemotherapy. But now, the chemotherapy isn't what it was. So, the necessity for it isn't as important. So generally in the area of oncology, we're still looking for those signals. We're still looking for some, and believe me, if pharma saw signals, they would be pouring tons of money into it. So there's that. Where else I see some interest is in pain relief. We've got obviously we've got an opiate problem. And it's clear that when people can use cannabis as either an amplifier of pain relief drugs or as a substitute for pain relief drugs, it could be an effective adjunct treatment. And so I think, gosh, let's take a look at THCP, 30 times as strong. That's definitely getting into the opiate range. Can we alleviate the anxiety, paranoia, and other symptoms that might accompany it? Yet to see. Maybe with a combination of CBD and THC. And the last area that I see, some real possibilities is with sleep. I'm still interested in CBN, but I'm interested in not CBN itself, but the metabolite of CBN. Again, 11-hydroxy-CBN, 5 to 7 times stronger than CBN itself. Did some preclinical research a long time ago with rats where I gave them a combination of CBN and CBD and saw some really interesting effects. We have 4 stages of sleep, and stage 3 is where we start having deep sleep bouts. And that's where things really start to get interesting. The CBN CBD combination produced as many deep sleep bouts as Ambien. But it didn't have the stage 4 sleep problems that Ambien has. Ambien just completely wipes out stage 4 sleep, which, if you don't know, that's like the most important part. That's where you get rid of metabolic products that have accumulated during the day. It's like essential for cognitive processing. So, I think that's an interesting area that we could pursue. Also, the other thing is that the CBN CBD combination did not produce the gamma waves that we see with Ambien, which is like this sense of disorganization that you feel with Ambien. Like you wake up and you're behind the wheel of a car and you're like, how did I get here? Or you're at the top of the stairs and you're elderly and you're just like, I'm taking a tumble here. THC CBD produce much more alpha and beta waves, which ends up being you wake up and you're alert. You're not completely disoriented, and it tended to have less rebound effects. In other words, the next day you're not as groggy as Ambien. So I think sleep is a really interesting area for cannabinoids that hasn't been fully explored yet.
CBG and gastrointestinal issues?
Yeah, there's a lot of anecdotal stuff out there on it, and it may be, and it has had tremendous benefit for Crohn's disease. So CBG may be, we haven't done enough research to be able to isolate CBG as the main factor that I'm aware of, research that I'm aware of. But that is also an interesting area for sure. Calming down, maybe in combination with a peptide like BPC 157. I'm all about combination therapies. The FDA hates them because you have to measure each drug separately, and they don't want to, have synergistic effects. But between you and me, I think combination therapies are where cannabis can really excel. It can amplify the effects of other drugs, and other drugs amplify the effects of cannabinoids.
So this would be a good segue into another plant that is quite interesting. And can you first talk about the plant in its pre-synthesized state, and what you find what does it have in it that you find interesting?
Oh, which plant? What are we talking about?
We are transitioning.
Oh, to coca? Yeah, all kinds of good stuff. B vitamins, the coca leaf it's interesting because it's been used traditionally for thousands of years as, like a cup of coffee, but it doesn't have sort of the debilitating effect that extracted cocaine has. So, and different coca varieties have different constituents. They all sort of act differently, but generally speaking, when it's just coca leaves that are chewed, they offer a certain level of recovery, I would guess, and resilience built into them. And also they seem to work well with the chemistry of high altitude. And that's why they were extremely popular, used a great deal in Peru and Colombia among the Incas, and used as something that would actually alter your blood pressure to make it easier for you to work at a high altitude.
I'm stuck on different varieties. I had no idea there was a multitude of plant like coca varieties. And what makes them different?
Only 2 of the 17 Orthoxylum species contain sufficient coca alkaloid to make cultivation worthwhile. And within those 2 species, there are 4 varieties that are widely farmed. Coca variety Coca, variety Ipadu, Nova Granitense, and Truculence. It's generally, these are all, so there's only really 4 varieties that are commercially cultivated, but there are, 17 different species varieties.
Where do those 4 fall into how the Colombians 500 years use them? Like, would they pick those ones as well, or are those ones like just chewing and having a general health and medical benefits, like that one's useless, or is it?
That's usually variety Ipadu is what's exclusively grown by indigenous people. Nova Granitense, variety Truculence is one of the commercial varieties in Peru, and in Ecuador, Bolivia, and Colombia, they prefer coca variety Coca. Some work better at higher altitudes, some work better at lowland altitudes. But the one that is kind of exclusively used for health benefits is this variety Ipadu that's sort of exclusively grown by indigenous people. It's usually grown, at pretty high altitude regions to produce. the thought is that the higher altitude varieties produce a better concentration of alkaloids, and that's generally considered the higher quality.
So if you grew that same plant at low altitude, it wouldn't produce the alkaloids in the same way?
That's, the general cultivation knowledge suggests that. Generally, they pick an area that's a sloped area, so rainfall doesn't drown the young plants, and they use, it's about 4,900 feet is generally a good spot. And they use a traditional kind of slash and burn process, clear the field, cut down forest canopy, and the seeds for propagation are gathered during winter and spring from plants that are 2 to 3 years of age. And those germinate in about a month, and they're transplanted at 2 months when the plants are about a foot tall. And then 3 or 4 inch cuttings are taken from existing plants. And that produces a plant that's ready for harvest in 6 months. Seed plants take 2 to 3 years usually to get sizable.
And so what was in a... Go ahead.
The plants from cuttings generally do not produce viable seeds for future propagation. You have to use seeded plants to produce to get seeds.
And it's not.
And by the way,
it's not dioecious.
These guys, no, these plants require regular pruning. They just keep growing. They can grow up to 30 feet tall if left unpruned.
So in a cocaine production field, what was kind of the balance of cuttings versus seed plants in a field?
Well, they do just like cannabis growers do. Your seeds allow you to control genetics, and so those would be like the got moms. A bunch of those going.
You have like
the moms, and then a lot of cuttings allows you to get up to speed very quickly. So generally speaking, cuttings are kind of preferred. It's harvested generally by hand, 2 to 6 times per year, depending on climate. And you kind of wait till the leaves have kind of a yellow tint to them, and then they kind of break when they're bent. Yeah. Lower altitude plantations are harvested more often than higher altitude. And the first harvest after the rains in March is usually the most abundant, and it represents about half of the yearly total. But harvests continue in summer and November too.
What do they consider high altitude? Like 8,000?
4,900 feet is kind of the mid altitude. That's the sweet spot.
That's where we're at.
Yeah, basically.
Give me those seeds, Peter.
I was gonna say, Del, I've been looking forever. I want to grow coca here, and mostly I want to chew it and use it as like the coffee substitute and explore that. But seeds has been difficult.
Be hard to convince the authorities that that's what you were doing, but generally speaking, we had some back in the day. I lost them. I had some in a greenhouse at one point, but nobody's interested in importing the seeds, I guess. Demand may change that over time.
So do you notice?
Important thing is,
do they still have the same, like I'm guessing the answer is no, depending on consumption. But is there same addictive effects on the raw plant than the extraction?
Processed.
Yeah,
it's just not possible to get. You'd fill your entire mouth up with a huge amount. It's just unwieldy to get enough to really have any effect that's even remotely close to what it's like to snort a line of coke. That's just physically difficult. I mean, you take a huge wad, you put it into your buccal cheek area, and it's like a couple cups of coffee. A huge amount would be like a couple cups of coffee, I guess. It's different effect though. It's not like caffeine. It tends to be like, from my experience, it tends to be like a more benign effect than coffee. It doesn't have kind of
The
the
jittery.
more downside, yeah, the jittery aspect that coffee has.
Interesting.
But yeah.
So, all right.
But
So, can you tell us your journey from you got an organic chemistry degree?
no, I'm neuropharmacology,
All
and
right. So
then
you had it.
as time went on, I studied organic chemistry because I was interested in the phytochemistry, botanicals, particularly in the psychedelic area. And then, as a graduate student, I had the very good fortune to be taken to meet Alexander Shulgin, the chemist who kind of developed the route to MDMA. If you're unfamiliar, he also created a number of psychedelic drugs that are very popular now, 2CB, just a whole bunch. And I presented to him that I was really interested in tryptamine compounds, and he gave me a sort of master class in the genre of DMT to 5-methoxy DMT, which I've always kind of been interested in because I feel like if you can get as much therapeutic value out of a shorter experience than a longer experience, then that's probably a more cost-effective treatment. And because the biggest cost driver is the clinician's time. So I was always interested in that. And plus, I had a pretty remarkable experience with it when I was in the Amazon. So I was always, just from a research perspective, interested in it.
What
So that's
what
my
time
introduction
period
to
is
chemistry.
this? What time period were you hanging out with him?
In the late 70s, early 80s. So yeah, I know it's like
It looks like a smart guy who knows how to have fun.
we did it by candlelight, practically. It was so long ago. But my introduction to all of this was, I was a graduate student without much money, trying to get my way through graduate school. I was there on scholarship, and it was tough, making ends meet. And so I'm with the Mazatec in in the Sierra Madre north of Oaxaca, and they're pointing out these mushrooms. And I don't know, something just clicked just because I knew about Gordon Wasson's experience with Maria Sabina. And I thought, you know what? I bet I can figure out how to grow the ones that are coming up out of dung. I can, figure out how to grow them. And what I'll do is I'll isolate cultures and smuggle them into the United States and figure out how to grow them and do a small commercial grow, and that'll help get me through graduate school. So I did that. I actually went to Chiapas and sourced, cultures from Palenque, which were by far, the most vigorous cultures I've ever encountered. They were amazing. And smuggled it into the country. Of course, everybody grows them in their closet now, but at that point, nobody'd ever really even seen them. They'd heard about them, and they might see like black decayed specimens from Texas or Florida if they were lucky, but those didn't last, and nobody really had the opportunity to see a cultivated cubensis at that point. And so I moved up to Mendocino County from Sebastopol. I did my first proof of concept outside, and 3 out of my 4 beds didn't work. They burnt up in the sun under plastic, but one of them worked under shade, and it produced pounds and pounds. And so now I've got pounds and pounds, and I started selling those. And I'm all, you know what? I get this. I'll just take this indoors. I'll be able to control all the variables. So then I moved up to Gualala and started working indoors in like a garage workshop and perfected sort of indoor cultivation. And then in Point Arena, there were some turkey barns that the Stornetta Ranch had 10 turkey barns with concrete floors, 30 by 100. And I was able to rent that property for like $400 a month. And I ended up completely renovating all of those turkey barns into a massive commercial mushroom cultivation
Now you're
project.
producing tons.
Now I'm producing tons and shipping them all over the country, and living in the underground economy, and it became sort of attractive in a way, and I made all kinds of connections. But then something happened. Reagan became president, and everybody, suddenly psychedelics were not of interest. They were looked at as self-indulgent, kind of like childish in a way. We're all about business now, and the drug of choice, the zeitgeist changed to cocaine, and everybody's like, this is what's up, and sales of psychedelics just fell through the floor, and it would tarnish your academic career, really, if you're associated with it. It was just looked at as non-serious. Timothy Leary, counterculture, all that. But by that time, I had been starting to work with cannabis genetics. And, I had early indica varieties, essentially varieties of skunk number 1, and related indica varieties. I'm not sure where I got them. I think they kind of came over from people who brought them over from the army, who had been in Afghanistan or in regions near there. And I started breeding them and coming up with some great shorter season versus all the sativa varieties that were out there at the time that were extremely difficult to manage. They wouldn't mature rapidly. It was a big pain. And so I was fortunate to get introduced to a couple of guys, one who owned one of the first coffee shops in Amsterdam, and another who was sort of just a major influence on cannabis genetics, Old Ed. And these guys sent me some seeds from Amsterdam, and I started crossing those with the indicas that I had, and I came up with some crazy good stuff. I wish I had it now. I think it's better than anything I've seen around, honestly. They sent me this stuff that was citrus. It was like, I swear, it was like you just ate an orange, and lemon. And then they had this other set of seeds that were more gassy, more lemon pledgy, antecedents, I believe, of Chem 4 type product. And so I started breeding hundreds and hundreds of pounds of seeds, growing indoors, and shipping my connoisseur weed around. And so, I don't know, I wanted to grow at scale. I wanted to do what I did with mushrooms and get to commercial scale. I just wanted to see how this would work at that level. And I had a friend who was living on the border in El Paso. Actually, I had the connection to the friend on the border in El Paso, who was getting 500 pounds of Mexican and 1,000 pounds of Mexican across the border, shipping it to Southern California. And it was better than average. It was, some lime green Michoacan, some stuff from Sinaloa that was a little better. But in general, the quality was very poor. It was, packaged poorly, seeds and stems, all kinds of crap in the load. And I don't know, something just clicked for me. And I just said, you know what? How about if I bring these Mendocino genetics to the cartels? That's how I can grow commercially. And so I approached my friend, who was the guy who was importing stuff across the border, and said, hey, do you know who we might pitch this to? He says, I know exactly who we can pitch this to. And so he took me to meet some of the patriarchal figures in the Juarez cartel. And the cartels at that point weren't the bloody enterprise that they later became, through cocaine and everything else. It was much more low profile. They'd much rather bribe you than kill you. And, it was just sort of a much lower profile operation than it became. And so he introduced me to some older patriarchs in the Juarez cartel, and one thing led to another. The next thing I know, I'm meeting Miguel Felix Gallardo, the founder of the Guadalajara cartel, and Rafael Caro Quintero, the guy who invented Sensimilla. He figured out, hey, we've got to separate these male plants from the female plants to get a really good product. And the next thing I know, I'm bringing my seeds down to Mexico to be used at Rancho Bufalo, which was their gigantic 2,500 acre plantation that was probably supplying somewhere between a third and two-thirds of the cannabis that was being consumed in the United States. So I actually presented them with a lot of business advantages. I said, look, I've got markets in New York, I got markets in San Francisco that I developed through, the psilocybin mushrooms. I knew Bifocal Bob, the head of the Jewish mafia in New York. I knew, people in San Francisco. We're going to just take this super large scale and bring connoisseur weed, Mexican weed grown at scale into the market. And that's what happened. I started, sending tons to New York and San Francisco. And things went very well. Suddenly I'm friends with the higher echelon in the cartels, and they're taking me to their parties, and I'm meeting Mexican political officials and the wealthiest families in Mexico who are also involved in the drug trade. And this story goes on and on, I could tell you, but at some point, Miguel Felix Gallardo said to me, look, we know that you have an expertise in chemical process engineering. We're getting this cocaine from Colombia that's very poor quality. Do you think you could help us clean it up at scale? Well, at scale, that's my middle name. I love that. And he was not someone you said no to, really. So I'm in so deep at this point, I ended up designing a very large facility in Durango that was developed to process the poor quality that they were getting from Colombia at that time. And so, I'll keep going. While I'm in Durango, I go to get the pharmacy to find headache preparation, get something for a headache. And I see that they're selling a pharmaceutical called Cofal ergotamina. And it's basically aspirin with ergotamine tartrate, which is a vasoconstrictor. It also happens to be the main precursor for LSD, using the original route that was developed. And so I said to my cartel friends, hey, 55-gallon drums of this are sitting around at the factory. You think you could get this for me? I said, yeah, we can get it for you. Of course. And we can get you any other precursor chemicals you might need. So I put together enough LSD precursors for everybody in the world 4 times over, smuggled it into the country, and that was kind of my exit out of the cannabis, which was starting to get, they ended up busting Rancho Bufalo, and kind of the heat was on the cartel, and this was sort of my exit out of the cartel. I'm going to just start making LSD. And so started making proof of concept batches of LSD that were coming out really well. I'll just continue. And I had a partner who thought I needed a particular chemical that I didn't need. So he went to the East Bay to get it, and he walked into a DEA sting. And he brought all that heat back to my major storage of chemicals in at the airport in Novato, which I had everything stored in a storage facility there. I go to check on everything. Everything's gone. All my stuff is gone. But it's sitting in the middle of the floor as a yellow Post-it note, and it says, "This is the DEA. Get a hold of us. Phone number. Nothing else." So I decided, well, am I going to go on the run or what am I going to do? I ended up lawyering up with some of the best lawyers in San Francisco at the time and went to have a chat with them. And the first group was the group that had, intercepted my friend. And he ended up, that group gave way to a much larger group who was a huge task force associated with the DEA, FBI, CIA, Alcohol, Tobacco, and Firearms, Department of Justice. It was a giant task force. And they said, well, Del, you're looking at 50 years to life with the amount of chemicals we've got here. And I said, yeah, I guess you're right. They said, but you know what? We're not as concerned about it as you might think. Because the nephew of a cartel figure that is a psychopathic killer. He's been killing people on the border right and left. They showed me mass graves that he had produced. And, he was involved in human trafficking and he was being tried in absentia in the United States. And he's made threats against the Border Patrol agents who are testifying against him, their families. We take this all very seriously. And I said, yeah, well, I do know the guy. I've worked with his uncle a great deal, but I do know him. I have met him. I don't know what you want me to do. And they said, well, we want you to kidnap him. So I got it together and kidnapped him. Well, I didn't really kidnap him. I baited him to come across the border. And I was told,
what year was that?
It was 1990. And so they told me, I don't know if you know how Juarez and El Paso works, but there's a bridge separating the two municipalities over the Rio Grande. Halfway up that bridge is Mexico and the other half is the United States. So he said, just get him to the top of the bridge. That's all you have to do. And so I got him to the top of the bridge, and there was quite the scene as, helicopters, they swarmed, everything. And I just kept walking away. They originally said, we're going to arrest you along with him so we can, preserve some anonymity for you. And so the U.S. attorney just dropped all the charges. So here I am.
Wait, but did we skip through all the cocaine lab stuff?
We did. As I said, Gallardo said, we know you've got an expertise in processing. So can you design, a facility, the equipment, SOPs? And so I did, and, was producing pharmaceutical cocaine at scale, basically using the inferior Colombian product that was showing up at that time. And had some interesting stuff happen there. I was working with, at first I was working with some people who didn't know what they were doing and they wouldn't follow my instructions. And we almost had a huge explosion, a huge fire. I managed to, get it out in time, but it came close. A lot of wild stuff happened.
But basically, you're building like big pharma processing labs with unlimited budget, right? Like your
if you can imagine,
like what?
Yeah, if you can imagine being in a warehouse. If you can imagine being in a warehouse of 55-gallon drums, just about as far as the eye can see, stacked 4 levels high. Each one filled with pharmaceutical cocaine, you have some idea of the scale.
That's insane.
So I, might not make the same decisions I made in my youth today, looking back. But I'm still pretty unrepentant. I do believe that we should have access to cannabis, psychedelics, coca, if you will. All drugs should be available to anybody, and we should handle addiction and that sort of thing as a medical problem.
Agreed. Absolutely agreed. Well, and but kind of get back to some of the medical stuff. We have Kelly, the honest smuggler, joining us again for the third time. He's
Kelly,
almost a regular.
what was the research paper, or what was?
It's by Zagair, Zgair, and it's got a long title, and it talks about how using lipids orally can induce prominent immunomodulation, something like that. But that's what it's about. It's about how you get CBD and or THC into your intestinal lymphatic system, and then have that induce through a complex bunch of cytokines and stuff, immunomodulation, which has worked for 7 years for me.
Let's see. So, God, I'm trying to find it. How do you spell that guy's name?
It's Z as in zebra, G as in go, A as in alpha, I as in indigo, R as in rascal.
Is his first name Athir?
Yes, it is.
Yeah.
Dietary fats and pharmaceutical lipid excipients increase systemic exposure to orally administered cannabis and cannabis-based medicines.
That doesn't sound like the one. The title to the paper that I'm talking about.
Cannabidiol bioaccessibility.
What I'm saying is dietary fats and pharmaceutical lipid excipients increase systemic exposure to orally administered cannabis and cannabis-based medicines. Could that be it?
Nope. When you find the right one, the phrase prominent immunomodulation is, I think, at the end of the title.
I'm stuck on co-administration of cannabinoids with lipids can substantially increase intense intestinal lymphatic transport in rats. But let me see if we can find.
That's close. That's a related paper, I'm sure. But this one had to do with trying it on multiple sclerosis. And like I say, at the very end, the phrase prominent immunomodulation is at the end of the title.
Here we go. Here it is. I got it. Oral administration of cannabis with lipids leads to high levels of cannabinoids in the intestinal lymphatic system and prominent immunomodulation.
Yes, exactly. That's the one. Yeah, that paper was a major insight for me because I was in Denver trying everything. I knew that I had got symptomatic relief using CBD, including pure CBD. But somebody had said, put a little THC in there, and I went for that. So at that point, I said, I'm going to Denver. I can get a med card easy, and then I can have anything I want legally. And so I tried everything and accidentally stumbled upon what that paper talks about.
Amazing.
Yeah, I had attended this seminar on using cannabis for autoimmune disease. Okay, so there was in the audience there were these people that had left the pharmaceutical industry to create products using cannabis and using pharmaceutical techniques of purity, etc. Right? So they had a secret incipient that was supposedly allowed their pills to be absorbed quickly. And they said, eat some food with it. They didn't really talk about what we're talking about now. But I accidentally discovered that I got this elation from these pills. And I thought, well, what is this? And then the paper came out, and then it was all very clear. Because in my case, what happened was I took a whole bunch of it, not with eating it. I just thought the stuff was so great, I didn't pay attention, really. I screwed up. And then a low toxicity pesticide got me real sick, And it turned out that's because CBD will hog this digestive enzyme in the liver, and that's a real important enzyme to metabolize drugs and like Tylenol, for instance. That's the problem.
Well,
that's where Tylenol comes from.
Explained that like absolute garbage.
Looking this over.
I'm sorry.
Go ahead.
Looking this over, this is pretty phenomenal, really. CBD in rat intestinal lymph reach 250-fold higher concentrations than plasma and THC, about 100-fold higher.
Isn't that amazing?
Yeah, and all those concentrations, both CBD and THC, suppressed immune cell proliferation.
Exactly. So about the chemical process, the biochemical processes?
Yeah.
I didn't. It was like a study for me. I studied physics in college and had some chemistry. Never took biochemistry.
Inflammatory cytokine expression. We have these cytokines that are biomarkers for the immune response. TNFA, IFNY, IL-2. All of those are indications of what your immune response. It suppresses, particularly in MS patients, who are more sensitive to the immunosuppressive effects than regular healthy volunteers. So, right off the bat, most cannabinoids suffer from heavy first pass metabolism and low plasma levels. And this suggests that when cannabinoids are taken with enough long chain fat, they can associate and enter the intestinal lymph before reaching systemic circulation. That creates a situation where plasma.
Yeah, I didn't want CBD to go to my liver because I knew about the first pass, 80%.
Plasma may still underestimate pharmacologically relevant exposure, and gut lymphoid tissues may end up seeing much higher local drug levels, and the immune modulation may occur even when the blood concentrations look too low to explain it. So this is important because the intestinal lymphatic system contains a large share of the body's lymphocytes. So a local delivery could be a way to influence immune function more efficiently than trying to drive high plasma blood levels, essentially. And autoimmune disease is the clearest opportunity.
So you're talking like a suppository delivery?
Well, I don't know if you have to do that. Remember, I was talking earlier about enteric capsules. So we've got this capsule that's got a coating, survives stomach acid, goes into the upper part of the intestine, the duodenum, and uses a lymphatic transport vehicle, these fatty acids that are being discussed here, to transport the cannabinoids through the intestinal wall and into the lymphatic system. That's how I would do it. And I'm sure Big Pharma would take a look at that and say, yeah, exactly. And so the target areas would be multiple sclerosis, inflammatory bowel disease, or gut-associated immune disorders, or rheumatoid or other T-cell driven inflammatory disease.
Yeah. It's like a miracle for me. I had very severe rheumatoid arthritis. I couldn't make myself take immunosuppressive pills. So it was Bruce, the king of pot. When I told him I'd been diagnosed, he said, go check out the endocannabinoid system. And so I did that, and I realized, oh, yeah. But at that point, when I studied the endocannabinoid system, this wasn't clear to me. I didn't even know there was such a thing as the intestinal lymphatic system. That was new to me.
What we're seeing here in this paper is that CBD seems to be the better lead molecule in this paper. Stronger immunosuppressive effect in several assays, and no THC-like psychotropic burden. Better tolerated at higher doses, according to the paper's discussion that I'm reading here. So the real plausible translational direction is not fatty THC edibles for immune disease, but rather lymph-targeted oral CBD formulations is what is, I think the direction that's being pointed to. So it's really
that certainly has worked for me.
A drug delivery paper with immunological consequences.
Yes.
So the main therapeutics, my mind is kind of racing here, long chain triglyceride solutions, self-emulsifying lipid systems, having capsules that are lipid-filled capsules, and you want to the nice part about the enteric delivery, it avoids the food effect dependent effect using a high fat meal or something like that.
Yes.
So you don't have the food variability. You go straight to the upper part of the intestine.
So
and
this
deliver
is
there. So
I'm sorry to cut you off. This is kind of where I was a little fascinated. We were talking about sunflower oil being the delivery method, just a tablespoon of sunflower oil, right, Kelly?
That's right. Yes.
So is there a volume that and I don't know if this study would say this, you might know, is there a volume that when you take a percentage gets past your stomach acids?
Well, I don't know of anything, but except it gets, apparently long chain triglycerides like sunflower oil, that's their mode of getting absorbed is into the lymph. I didn't actually understand that. So the MCTs, the medium chain, they get absorbed into the plasma, and so the key here is getting it into the lymph. And also it's an affordability issue. Because go and look for a long chain triglyceride in volume, and you're not going to find it except in Walmart.
If I was doing this, I would think about developing a CBD-rich oral lipid formulation that was specially engineered for intestinal lymphatic transport.
Now, see, I agree. I'm so happy to hear you say that, because you're knowledgeable. And you're solution oriented, apparently, right? And so I just treasured the idea of talking on this with these guys in case somebody would listen and then try it out. I wish bad. I suffered for. Go ahead.
I would target MS. I would target Crohn's or colitis, and I would target other autoimmune inflammatory conditions.
Yeah, think how if people could experience what I've experienced, it's so phenomenal. But back in the days when I started, in the days of that paper, in fact, it just wasn't something that people were looking for, remission for autoimmune. They were looking for symptomatic relief, and there was that. But to go into remission and not have symptoms, it's really remarkable.
That's amazing because I think there's a very fruitful line of research here. I would compare 3 arms just to kind of resolve the questions that you brought up. Fasted oral CBD, that's one arm of the research experiment.
Did you say fasted?
Yeah. What we want to do is we want to compare. Okay, what's our baseline? Fasted oral CBD, that's one baseline. Fed oral CBD with a defined high-fat meal, like you said, with either sunflower oil or a high-fat meal of some kind. So you've got fasted oral CBD, and then you've got
fasted
fed
is
oral
taking
CBD.
it on an empty stomach.
Right, taking it on an empty stomach, and then we do another arm that's fed oral CBD with a defined high-fat meal. And then the final arm would be an engineered lipid-based CBD formulation that went straight to the duodenum and released there. And
that would be so cool. That would be so cool.
And then it wouldn't matter whether you've eaten or not because it's just doing its thing and releasing in the right spot.
Yeah,
it's not combining with other stuff.
Yeah, I mean, it would just be a much more targeted kind of release, and you would use biomarkers to really examine how it affects the immune response. But this does not show that patients actually improve clinically when cannabinoids are formulated for the lymphatic transport.
You're saying in this paper?
In this paper, and that's why you need the follow-up paper.
Absolutely, yes. I hope this happens as soon as possible. Because, like you're saying, if you get, I don't know if you go placebo-based or not, but to get clinical controlled trials and that could the research of which resulted could be presented to other scientists, then it could really stimulate something that could end up real good. It's like the
with Schedule 3. I would
Yeah.
imagine the follow-up on that, because they can do extended medical studies.
Yeah.
with
So
it.
what this study shows is the rat biodistribution. It shows the ex vivo and in vitro immune cell effects, and it gives kind of a mechanistic rationale for a therapeutic use, but it doesn't show clinical efficacy in MS or autoimmune. It doesn't give the exact human lymph concentrations achieved after a high fat meal, and it doesn't
Right.
give the long term safety of intentionally driving cannabinoids into the lymph, and it doesn't show the exact right dose window for immune
Now-
modulation without over suppression.
Sounds like you
Yes.
need to
That's what you're trying to
volunteer
do.
for a case study, Kelly.
I'm ready. Oh, now here's something I find perplexing. When you look in that paper, you find that the dose they used on rats to make this work is 12 milligrams per kilo. I don't use nearly that much. I don't use more than 200 milligrams in that tablespoon I take every night. So I'm a little
Yeah,
perplexed
that's what you
by
want.
why it works for me at such a relatively low dose compared to the example in that paper.
I would say that there are certain safety implications with this. It could be risky in immunocompromised patients, especially cancer patients or something like that on chemotherapy, if the lipid-based delivery pushes lymphatic cannabinoid exposure high enough to suppress lymphocyte proliferation and inflammatory cytokines. That could worsen an already fragile immune state. So you're going to have to be careful about dose, as you said.
Yes.
A therapeutic use is going to have two very different goals. In an autoimmune disease, immunosuppression might be desirable, but in chemotherapy support, where cannabinoids are used for nausea, extra immunosuppression could be harmful. So you
Absolutely, and I'm glad you brought that up, because one of the things that I emphasize when I talk about it informally is that we're talking about immunomodulation as opposed to immunosuppression. And of course, that's what's happening what happens for me is it's obviously immunosuppression. But my question is, okay, now, like you're talking about, in the case of somebody that's immune compromised already, then would you still get the same negative effect of immunosuppression as opposed to enhancing immunity?
Well, I would say that the strongest therapeutic opportunity from this paper is CBD in a lipid-based oral formulation for autoimmune disease, especially MS-related immune dysregulation.
I would so love to see that.
That's where I think the most important caution, though, is that the same strategy could be unsafe in immunocompromised patients. So I would stick to trying to see how, because it did say that MS patients were more had a better effect, basically. So if you're immunocompromised, it I mean, if you're trying to modulate, this might be the best way to go. So a concise translation: don't think of this as cannabis with food. Think of it as a lymphatic drug delivery platform for cannabis. That's
absolutely.
Where I would go with it. Yeah.
A lot of food has LCTs, right? So the idea that they said to eat fat with it, I mean, eat a meal with it or some kind of food, it all makes sense why it worked, these pills. But I'm not sure they understood what was going on, because for me it was just an accident. Like I said, I was trying everything, and I did realize that using these tablets, they gave me this elation, this profound sense of physical well-being that at this point, just anecdotally, I associate with effective immunomodulation occurring.
Yeah. I obviously, as I said, this lacks the clinical dimension that you're really after to start demonstrating what you're experiencing.
Well, it's like we were talking about earlier. It's the start, right? Like, it's especially with plants like cannabis, it's hard to, I think, further beyond a certain point until there's a certain, like a legal element is lifted. And I've brought up my brother-in-law a few times on the show, and he's a pretty recognized, I I don't know. He studies blood. He works out of CU Anschutz, and there's been a couple times he's wanted to study cannabis, and he's been hemmed up just strictly because of the federal law side of it. So it's interesting to see, because there's a few papers like this that have come out, and they're like you said, they're not really complete. And I think that comes up with like all the follow-up studies that need to happen that are essentially all the scientists' hands are tied until it's like, okay, now this can legally happen.
Yeah. This paper points toward a delivery strategy, not just a molecule effect. The clinically interesting question here is whether you can turn oral cannabinoids, especially CBD, into a lymph-targeted immunomodulator by controlling formulation. And that's different than how cannabinoids are usually used in practice, where they're mostly treated as symptomatic agents. And PK variability is often just an accepted fact of the way they work. And so the best fit here is, for my money, is still MS and other immune mediated inflammatory disease. The rationale is strongest for where you have T cell proliferation and cytokines, because those are the axes the paper shows being suppressed at lymph relevant concentrations. And in that setting, the goal would be to move beyond symptom control and test whether a lipid enabled CBD regimen can produce a measurable anti-inflammatory or disease modifying effect. That's the next step.
When I talk about all this, I stress that my experience is entirely anecdotal, and what you're talking about is so important, because, I don't blame people being skeptical about reported anecdotal results, but the clinical scientific work that you're talking about is something that will convince the majority of people that are well educated.
And there's something else in here. Where it really gets interesting is the patient selection. Their human ex vivo data suggests that PBMCs from MS patients were more sensitive than those from healthy controls, which raises the possibility that an immune dysregulated subgroup may derive more benefit from cannabinoid immunomodulation than a general population.
Yeah, that's the kind of thing it'd be great to determine.
Yeah. So, and then there's also, you gotta have no drug interaction risk. CBD's pretty, safe from that perspective.
Well, and that's what I was going to say. Like, you almost have to completely stop from any blood interaction too. So you can't, you shouldn't be smoking anything CBD. You shouldn't ingest like the food part to get into your plasma part. Like, all that has to stop as well, so that you can get a clear baseline what's going on.
In the present clinical landscape, there is no established lymphatic delivery cannabinoid therapy for MS or any autoimmune disease. Current cannabinoid use in MS remains basically symptom oriented. And so this would be a considerable departure to actually see.
My experience is so profound. I call it screaming agony, because I would wake up screaming, and then during the day it would hurt so bad I'd go in the bedroom, stick my head in a pillow and scream. And
Kelly, I think you're onto something here, honestly.
Yeah.
Boy, I'm gonna have to write a paper about this.
Yeah. Here's something. When we talk about the legality, I think about how Mitch McConnell forced the Republicans to accept a rule in that farm bill that hemp and everything made from it is legal. So with respect to Delta 8, I think that that's wide open as far as I know legally. I don't know if the money would come to do the work, but I know that as far as I know about the legality is there. So I'm greatly encouraged by what he did.
In my experience, just off the top of my head, I would say it'd be about $500,000 to develop this delivery form, and then to do the clinical trials might be another $1 million. So
Now, did you say billion or million?
million. $500,000 to develop this product.
Oh, that'd be great.
The enteric capsule delivery, and then $1 million probably to do the clinical trials.
Yeah.
And Big Pharma would have to see some upside at the end of that to make it worthwhile.
Well,
And see, this is where I think, what would be really cool is if we had a nonprofit that was funded by the community, maybe some industry people who are making money, maybe, crowdsourcing on a really broad level. And $1.5 million isn't really that much money.
No,
really,
no, it's not.
And suddenly we have a drug with a delivery system in the public domain that pharma can't touch, and we have prior art and we own it, and it's public access and public support, and we make it available to researchers who want to do legitimate research with it, who want to do legitimate clinical research with it. And that's the kind of initiatives that I see, like if we could go forward with stuff like that, then we can prevent Big Pharma from capturing and siloing these kinds of treatments and end up, making them cost a fortune, making them real inaccessible. And then it becomes, will insurance pay for it? We could find ways to make it so inexpensive that, basically it wouldn't require a great deal of insurance coverage. So that's my goal, is really to develop that public access, public domain.
That sounds so good.
Project. Yeah. I got a paper on my Substack, and I forget what it's called, but something like proposal for a whole plant formulation, basically describing how this would work with a nonprofit so that we could do these kind of things, trying to get some momentum behind it, just to see if it might work. But $1.5 million, that's like nothing. Really,
that's chump change, really.
Pharma's like
that
5
was
to
what
10
I was
million,
thinking when I heard
usually.
that number.
You talked about full plant, and now I got the impression a long time ago that Rick Simpson oil was full plant, but I don't see where that's true now.
It is, but this is what I was trying to describe. There's a process in pharma where they take a look at Rick Simpson oil. They make a pharmaceutical variation of it that's standardized, and then they say, this is what we're going to advance through the regulatory process at FDA, and we own it. We basically own that.
That could happen. Huh? They could have ownership of it, patent-wise.
That's exactly what could happen, and that's the fear, particularly with descheduling, is we are at a crucial turning point right now, where if it is descheduled, pharma's going to run in and they're going to say, they're going to read papers like this. I mean, in this case, it's not a whole plant formulation. It's primarily CBD is what they're saying.
Right.
But, they're going to rush in as much as possible and claim as much territory as possible.
Right.
And all they have to do is just say, hey, we're doing research on it. And then all of a sudden it makes it difficult for everybody else to do that research.
It's going to be like a land grab of easy stuff that they were just first to throw lawyers on it.
Yeah.
So let's make a publicly accountable, democratic organization that tries to do the same thing, that's crowdfunded, crowdsourced. I know for sure that, it's difficult to get everybody in cannabis on the same page because we're notoriously rebellious, but maybe the good sense of this can appeal to a lot of people.
I want to make a quick point about the pharmaceutical industry and RA. Humira is already being competed with by other biologics or whatever. And so also their exclusive is running out. So this is a time of transformation, and it might fit in well for people to be offered this tested, confirmed clinically process to try to deal with autoimmune.
What people don't realize though is one thing that's really important. This paper talks about delivery mechanism. A delivery mechanism is considered by the FDA just like a brand new drug. It's as if you came up with a new drug, even though it's got CBD in it. So you can have that exclusive runway, that runway of exclusivity and patenting and everything else, just with a delivery form. So we say, okay, we're making an enteric delivery of CBD, and it's going to have some special bells and whistles in it. Boom. That's just as if you came up with a new drug.
Yeah, I was not aware of that. That you could achieve exclusivity by transport method or absorption
So
method.
formulation and delivery. You can take a generic drug off the shelf, reformulate it in delivery, and deliver it, and reformulate it, and end up with a brand new drug. And somebody just said delivery can't be patented. Yes, it can.
This is really encouraging to me.
I just patent.
He said it
delivery.
can.
Oh yeah, no, it can be, definitely it can be, because I have 7 patents in the area of delivering peptides through oral thin film, and basically you can patent the delivery form, and we, the public, should be patenting those delivery forms.
So you can use somebody else's. So I just so I can get clear, you can use an existing delivery form, but because you're using a new compound to deliver, that same delivery form has to be can be repatented because of the compound inside of it.
Essentially, what you're doing is you're taking an existing compound, you're marrying it to a new delivery form, and you demonstrate that it serves either a particular patient population or better serves an indication, or you make an argument that it having this delivery form improves upon the original. FDA looks at that, and if it's a generic, it's the regulatory path is called 505(b)(2). Instead of giving you, like 5 to 7 years of exclusivity, they give you 3 years of exclusivity. But you have exclusivity also in the patents that you developed.
Yeah.
So.
Yeah. Well, it didn't occur to me that pharmaceutical companies would be interested in something like this, but now from what you're saying, I'm greatly encouraged.
Yeah, I mean, they're not going to tell us what they're interested in. They're just gonna go get it, and they're looking at, and this administration, I don't think they're very sophisticated. I think they're going to say, okay, it's medical, we'll just turn that over to the FDA and to Big Pharma. They're not going to have some sophisticated program that says, well, maybe some of this should remain in the public domain. They don't seem like they're that concerned about, what stays in the public domain. There's going to be some big pharma plays coming up,
and
here.
They're bad actors. So
don't get me started.
Oh, there's
shitty things.
Man. So yeah, really interesting, Kelly. I'm glad you brought this to my attention. I'm going to take a real hard
And that was
look
cool.
at
This
it.
was the
Maybe
conversation I was hoping to have, is to like bounce the stuff Kelly's seeing off someone who can translate the science and be like, that checks.
And what's amazing is your clinical reaction, saying to what extent it improved your life, and how,
wow, it's immeasurable, really. I'm a guitarist, and I was getting finger locks and stuff, and my grandma, although she lived to be 105, she had RA, and her hands were all gnarly from this, and I thought, man, I'm taking a risk, because the immunosuppressive pills you get can keep you from getting your joints eaten. But then you're exposing yourself to other usually harmless, viruses or bacteria or fungus even, that, you're in trouble because you've suppressed your immune system in general.
Mm-hmm. It's absolutely correct. So you got to be careful about it. But for something like MS, I think, this could, offer, whether or not it actually has a disease effect, yet to be demonstrated, but it definitely seems to help with symptoms.
Yes.
So Yeah, and there's like tons of stuff like this, I think, potentially with cannabis. Maybe we haven't looked at delivery enough, for how we can make better drugs with cannabis. The deliver
Also,
formulation and delivery is my whole thing.
also, from your podcast, guys, I've learned that, for instance, CBG is really a significant cannabinoid, and it just so happens I didn't notice this before, but this Phoenix Dulce Haze cultivar is actually a CBD/CBG formula, genotype or whatever you call it.
Nice.
So I had no clue. I knew CBG was the apparent, but I didn't know about the analgesic effects that I've heard on these podcasts that you can get from CBG.
Well, and it's such an amazing
100%.
testament to how the whole plant material needs to be considered. Because, and I've always said this, when you take what we look at with the plant as like our holistic medicine, when you start isolating those compounds, you're not getting the same thing. So and just from what I understand, you almost have to create those ratios post concentrate form in order to, like, you basically would analyze your plant and then put that together after you've isolated all the compounds. We don't have access to all the compounds yet, so it makes it tough. But when you can start stacking what we know, CBG, CBD, THCP, like you start stacking these individual isolated compounds and then reintroducing the terpenes, I think we end up with this really interesting medicine.
Well, that's the approach that Mechoulam favored. I was a little skeptical because it seemed like maybe he was leaving off some of the entourage effect that where the cannabinoids together are synergistically effective compared to them alone.
Yeah. Again, we're going into a period of time here where the descheduling will definitely encourage research. There will be a lot more research, but who gets to own that research? We'll see.
Hey, I'm really glad you guys got me on here. And sir, what's your name?
Del, D-E-L.
Oh yeah,
Potter,
of course.
Potter.
You talked about Del. Yeah, I'm right in the middle of something, so I need to go. But boy, I'm sure glad you hit up me, because now I'm really concerned. And here, listen to Del, I feel like, okay, now we're moving along with something that could really get things going.
Yeah, no, there's a big reason why I wanted to bring you on, Kelly, because after having you on the last couple times, Peter and I have been curious, and I know a lot of our viewers have been curious, and to have somebody who's heavily studied biochemistry, just made sense to get you guys chatting.
Well, honestly, designing experimental experiments is kind of methodology is my thing. As soon as I saw that, the light went on. I mean, I see where we could take this, and what potentially might come from it. So,
very encouraging.
Thank you for bringing it to my attention, Kelly.
Thank you for being on, and somebody like you adds weight to it, especially given your parent focus on delivery and clinical demonstrations.
Yeah, and so, again, one of my foci is definitely with combining, peptides with cannabinoids to achieve specific therapeutic effects. There are immune modulating peptides. There are peptides that, might help, amplify these effects that would make an interesting combination therapy. But just your anecdotal report about how beneficial it was to you, I think, is a great signal, of what the potential is here. Boy, I know people with MS who are, completely freaked out about it. They're doing various peptide therapies. Be interesting to add CBD to that regimen.
Yeah, I didn't know that MS is autoimmune. I was ignorant about that. But I've certainly learned.
Yeah, yeah.
Okay,
So,
guys.
That was
That-
interesting when we talked about that last time. That's
Yeah.
that's an autoimmune thing.
I got to
All right.
run to actually get some work done.
All right. Well, thank you
and,
both.
Great talking to everybody.
Yeah,
You
big
too.
time.
Talk soon.
All right, Kelly.
All right. Bye-bye.
Okay. Take care, y'all.
And then there was me and possibly Jeff. Yeah, that was why I wanted to connect the science / chemistry with like the anecdotal. Can we get, you want to jump on?
I knew I picked the absolute worst time to go to the bathroom.
You come back, everyone's gone. Hold what you got, jump on, and I will smoke with you. Although I'm already very high.
Oh, I'm on mute. Oh, that was funny.
No, that was a super interesting conversation.
Oh, it was absolutely like you said, I was hoping that would happen too, because there were so many questions we kept having that Kelly couldn't really answer. And to have somebody who can bring a study onto layman's terms, like when I read those things on my own, I basically have a printout paper and I'm like highlighting stuff that I need to like learn how to pronounce and like understand before I can fully comprehend this. So reading some of those papers takes me longer than I think anybody else that's a professional. So being able to break that down onto like layman's terms really does kind of highlight what is actually possible, because I don't understand half that shit until it like gets broken down like you're explaining it to a 4-year-old.
But connecting kind of what Del was like, I feel like we've talked before, like FCP non-profity something, right? Like where some of it, like imagine like we get the patents and make them public domain or like a technology, and maybe that gets licensed and it funds the nonprofit, right? Like it would be like, and then the nonprofit has a mission, right? And it's like,
well, it's being able to provide
it's
something
it's
consistent.
Policy, it's health, it's science, it's research, it's patience.
No, I think it's really cool, like that idea. And I didn't even think something like that was possible, but it makes sense. Like, let's build and acquire these patents and then just hold them to be cheap. And if you do it as like a group organization, it's harder for somebody to sell out.
And this gets to kind of my in my head response to Jade Nectar, which is there's the world we would all love to live in, and there's the world we live in where all these pharma companies, it's like when I watch my kids do Easter egg hunts, right? So you have like all the 5-year-olds in one age bracket and like a field of eggs, and they release them. Mm-hmm. And like the kids are all running to like that's my vision of what the pharma like, but they know which are the good eggs, right? Like the rest of us are like slow, right? And they're like, we've staked a claim to everything, and then everyone's like, that's bullshit. But if you could preempt them,
well, and I'm like, we're as a community, and this goes back to like what Tony was doing. We have a lot of like people volunteered.
Yeah, it's the 420 profit. It's a special category in the IRS.
So when you can take all the anecdotal evidence that the medical cannabis community has already acquired, we could fast track a lot of this stuff because we already kind of have an idea what we're targeting. So it's literally like understanding
centralized open source databases of
yeah. It would not take long to fill a lot of that stuff in, and then you just reach out to all those people. Hey, we're doing a case study on this. We understand you're this kind of patient, blah blah blah. Here's what we need you to do. Everybody and their mother would be on board with that. I don't know a single person to be like, no. So,
well, you know, you think back to, or even the stuff that Phylos, like the Galaxy, if that were in a public domain, it'd be the fucking coolest thing, right?
Right.
So.
Yeah, that was fun.
What's up, brother?
What's up, fellas?
How's it going?
What's up, dude? How you doing, Jeff? It's Jeff, right?
Yeah.
I know that.
We have some beard on beard action going on now. I like it.
Yeah, mine needs some good influence. You know, it doesn't have any positive beard models.
It needs to see inspiration.
Yeah.
You need to figure out how to lock down these coffee and vomit terps.
That's the handlebar mustache.
This is the fucking. I lost my razor, buzz patch.
Yeah. So you were saying when you talk about what you sent me, like what worked for you.
Hold on, I gotta pack up a 1,000-gram dab to fix get myself on.
I just wanted to say that was a killer show.
Thanks, bro. We had to come back strong.
Man, backing up what we all, well, not all of us, but a lot of us have seen with patients, with science like that is what we need to fucking move ahead.
Well, I was kind of talking to Tony or Peter behind scenes, like we need to collectively find like topics and papers that are published and everybody really wants some elaboration on, and then bringing on an expert, even the researcher themselves to really break this down on a layman's terms level. So we can, you know, we've got a lot of, and I was saying that earlier before you jumped on, we've got a lot of anecdotal evidence, you know, and I would say it's even slightly beyond that within the groups of people that, you know, caregivers have taken care of for so long and what they've seen over extended periods of time, not just short study. Like some of these cats, you know, been taking care of people for 20 years now. Like there's a lot of, at least a good pile of anecdotal evidence that could back up and accelerate a lot of this stuff. And having it public domain is where we all want it anyway. We want the medical science behind it, but we don't want big pharma to fuck it up. And so public domain is really the solution. And we just have to do it before they do.
It would also be cool if you could commercialize technologies, make them public domain, but then be like, and by the way, anybody who's a small business can license our technology for free. But if you're, as you become big business, you have to like pay into it. So like,
yeah, that drives the nonprofit side. Yep.
Small businesses, not just like two companies.
And well, you could build it to like a union. I don't want to say it like that, but you could have people who breed and contribute genetics, and everybody that buys those genetics contributes directly to that nonprofit. So it's like having dues-ish, right? Which would drive the research further. Yeah. Which is already like what Peter was saying, like FCP's like pretty much set up for that almost.
Now the whole not like I don't have time for anything, so I'm always like doing a nonprofit would be cool, but super time consuming.
Yeah.
Right.
Yeah.
So you need kind of the team of
experts.
Shit, remembering to brush my teeth and hair is time consuming.
Yeah.
What the fuck?
Actually, as you said that, I was like, fuck, I don't think I've brushed my teeth yet today. but I'm okay with that.
Yeah, kind of co-op-y, but not quite. It's a little bit beyond a co-op too. That's what I mean.
SCP needs to crowdfund an EEG machine and hook me and Jeff up to the EEG. We just taste test different herbs, and y'all watch our brainwaves.
You know, I'm telling you,
I'm all about it, son.
What it was like? Was it Josh Yellowhammer who was talking about the small device that like is probably $5,000-$6,000 or like $5,000 to $10,000, but like can test for all sorts of things. So if you had like there's a place where we have that and we're like testing things, and
it's like when the homie Nick was in the hospital and they tested his brain activity when he was using cannabis and not using it, and his fucking baseline just went like perfect, what they wanted when he was on cannabis, and without it, it looked like they were fucking giving him shock therapy and shit.
Yeah, it's wild, actually. My last couple of EEGs have just kind of been non-cannabis use and then cannabis use. And there's almost no activity towards epilepsy with like small dose. Heightened levels of THC can actually trigger epilepsy.
I tried to bring that up the other night.
Perfect area.
Yeah. Trigger all kind of mental fucking problems.
I tried to bring that up the other night. With having
people that are mentally ill don't want to admit to that. They want to just keep getting fucked up.
Relative to other cannabinoids.
Yeah. It's so wild how like when you have a plethora of other cannabinoids, you can drop almost all the other numbers and improve efficacy. And you can. Nobody wants to hear this, but you can actually consume cannabis, not get high, and have a medical fucking line that's where you want to be.
There's 100% a level of cannabis consumption that I can use and still have an appetite, not have pain, and not have seizures and not be high. There is a blend. Yep. Like I don't have to be so fucking faded I forget to take my epilepsy medicine, or there's so many different. It's just so variable.
Oh, and it's with everything too. Like when you start targeting specific elements. And I know briefly about this, so I typically hate bringing it up, but I talked to a few cancer nurses, and there's literally like lymphatic node cancer, THC will accelerate its development like 100%. Fucking sugar, right? So there's like times to use specific cannabinoids when you're treating specific elements, and that's where you have to start getting into pharmacology. Again, patenting this application and delivery is really what is going to help patients. I don't know. This whole thing is kind of wild to me because I've always been like, yeah, fuck the pharmaceutical side, but
no, you can't say that because they've specialized in treating humans. They just don't treat us ethically. So you got to combine both sides of it. Like the science pushes our passion and what's ethical. We don't want to test it on monkeys and each other. We want it to work before we give it to you. And that's the difference. That's why taking in the info that you have with seizures and Holla has with seizures and anyone else and using that with the science available, instead of just looking for new people to guinea pig, check the people that have been utilizing low dosage of multiple cannabinoids instead of singular ones, because singular's wrong. We all know that. With every disease that we're fucking with, if we can mix the cannabinoids with the right level, it'll work for us. So we're not going to be able to breed a plant to do that. We have to be able to take it down to a concentrate, clean it of all impurities, and put it into a form that we can utilize. If it's from smoking it to eating it, like bringing up the lymphatic usage, we can't smoke lipids. Lipids are going to fuck us up. But if we eat them, it helps deliver that in our system by going through our intestinal system, right? And using the correct form of long chain or small chain triglycerides. Like, look how long people have just been saying use short chain triglycerides, use coconut oil. It's not the most effective way to pass cannabinoids for different types of ailments. And they just want to keep saying the same word over and over and over because they heard it on a podcast, they read it in a book, but they didn't research the science side that brings those two together. And now instead of hurting your grandmother that you're giving 2 grams of fucking RSO2 or fecal, whatever you want to call it, give her the right amount of the correct cannabinoids to fight the cancer or whatever you're treating her for, be it MS, seizures, or cancer. Those aren't all treated the same. If you gave them the same amount of everything, you're going to hurt one, if not all of them, more than you help them. That's just a fact.
It's all
And
drastically
anyone that
affected.
smoked cannabis long enough should know that already, and is utilized it for any kind of medicine should know that and shouldn't want to hurt their fellow friend or a patient they're trying to help. They should want to be educated on that info.
Yeah.
That's why I had to come on and tell you that today's show was great, because you got the info behind what most of us don't understand. Like why is this working? We want to know that, because going from being stuck on stupid and wishing we could help to understanding something and now going in a direction that we can all go look up information on today. We aren't experts in nothing we heard today, but we aren't as stupid as we were before we heard it. That's for sure.
And the other half of that is we inspired, like, dude, it was so cool seeing homie read that article, and you could see it on his face.
Yeah, that's why I remember before he was skeptical of like everything we said we remembered from what was interesting about what Kelly was discovering. And then as he's reading through this, he's like, oh wow.
Yeah.
Oh wow.
Yeah, seeing that, I was like, we really did something today, because he's going to take that. He already said, he's like, my mind is racing with this. All the directions it can go. So he's going to start seeing who's taking what where with what information. It's like
that
cracking a little bit of a door open.
Like us for that fucking light to come on, because they're looking at it clinically the way they were taught to look at an experiment, and we're not experiments, man. We're people, and just that little amount of information that got passed from a patient to someone that's not the patient, but that can help with the science. That's the spark we need, like 100%. It's going to drive shit forward. That we totally need more of that. If we could do it every day, it'd be great. But once a month is like better than never. Once a year, you know what I mean? That if we only did that today, that was better than it never happening. Yeah. Especially like, just think of it, Kelly, not knowing that it's autoimmune disease. Like, you'll deal with something your whole life and not even be fully aware of what you're dealing with. Because
my brain goes, how do we replicate this show? Like, not the same people, but how do we replicate this same thing where it's like anecdotal patient, scientific paper, expert?
In the next episode, hopefully the guy who did the research will be on, and then you'll have like him, Dell, and Kelly, and then we can ask him questions. Because remember, it was like, what should be researched next, and then it's like, what are you researching now, which is after the paper.
Yeah, that's true. Just a continuation to see it to the end, because you can get into all these rabbit holes and run into the same thing where it's like, I don't have enough information. Needs to be a further study type thing. So that's why I told Kelly, if there's a case study that pops up around this, he needs to volunteer his ass, because I think that's the other side, is how many people are willing to expose their even today, like how many people are willing to expose their cannabis use and then follow the rules of the study. You know what I mean?
That's
like, no smoking for a month to do this. Yeah. You're like, fuck.
That's going to be a hard part. You're going to, half of them for sure are just going to be like, I'm going to do it anyway, and say I'm not. Right. And that's going to fuck everything because of the pain they're in. Like, not because they want to fuck with the system, but like he said, screaming in a pillow, right? I do that same kind of shit. Like, there comes a point where like, I need to have something so I'm not screaming in a fucking pillow. And if you're at that level, it's hard to know that what you're doing, if you stop for a moment, could lead to a future to help everybody else. That pain level is hard to fucking deal with sometimes. So you get people in there that will say they weaned away from it and didn't, which will affect the outcome. That's hard to deal with. You almost have to test people before they start to make sure they're clean of any cannabinoids. And that right there, that's going to be an issue with a lot of folks that are using cannabis, to be tested, and it's just hard.
Yeah,
it really is. But that's what's needed. You really do need to have people that are willing to come off and deal with the symptoms, so that a short 30, 60, 90-day trial could actually affect them long term better than how they're dealing with it right now. Like, How long did it take Kelly to realize going down to 200 milligrams was better than fucking smoking as much as I could get my hands on? Or if he did, I know a lot of people with MS did that. As I created my Mudbone line looking at MS patients because I didn't want to give them the strongest weed in the world. I wanted an effective plant, and by giving it to people blind, I was able to find which one of my cultivars seemed to work better for it. And then it was up to them to decide how much do I need. I couldn't tell them, oh, you can only have half a gram or a gram. Like some people have more symptoms than others. Some it's so mild it may not even show up. Some people feel like they're on fire all the time, and just to keep that at a baseline takes a slight more. But to have the right cannabinoids, which is something now we know about. Like 20 years ago, we didn't know about THCV and CBG and CBN and how they affected the body. Today, we could mix that into a medicine, which is where I think those studies need to go. We know they work. What mixture of them works better for the patient than just going CBG isolate or CBD isolate or THCV isolate, which if we mix those in ratios, does it become highly more effective, like with THCV and CBG with like Crohn's disease and ulcerative colitis, helping reduce the amount of food you want to intake and reducing the amount of inflammation on the system would be a twofold benefit as just taking one of them.
Right. Right.
There's so many
anybody watching know a tax attorney to help us launch a nonprofit? Just send me a list of everything we need to do.
Omar
Figueroa.
Yeah, we got reach out.
Jeff, how did you get them to let you use cannabis when you were having the EEG, or did you have EEG at home? Did you have a home EEG on?
No, so it's not really like they didn't really direct that. That was
I was going to sneak it in. I was thinking about agreeing to do the test and getting locked in and sneaking it in with me, not telling them. And then see what
that was more of an indirect thing where it's
that's
like,
what I'm thinking.
Yep, I'm not going to use for. It
even
wasn't completely out of my system. It's like I'm not going to use for 36 hours or 72 hours before my EEG, and then I'm going to smoke like right before, and that was kind of how it went. So I don't even know what was in my system at the time, but I do know like this is enough, and this is like not really enough.
How much does your diet play into the entourage effect? My diet plays a huge role.
Oh, an absolute massive amount.
It's more important than the cannabinoids.
Like any amount of like if I consume a lot of sugar, it has a big impact. Like ideally, and this is always kind of wild to me, ideally it's like good fats essentially insulate your brain. So if you can consume like bacon, avocado,
good fat, not Girl
nuts,
Scout cookies, like bacon fat, meat tallow, but not Girl Scout cookies,
like that type of stuff for whatever reason helps insulate your brain, so it shortens the grand mal seizure, and it's not as intense. It's kind of wild. Like a lot of I saw a nutritionist and they showed me a shit ton of research around this, and they're like, yeah, have all the bacon you want, like especially because your metabolism's high, like it's not
my kids eat so much. That's positive information.
That's part of what the guy was talking about with lipid transfer, like giving us cannabis with the lipids. When you eat that, your body absorbs it. We live off fat, y'all. Like we have to have fat. Good fat's what keeps us healthy.
Yeah, omega-3s.
Really. It's like what your brain is made out of.
I cook with the bacon fat, so we'll make
and then
bacon
you get the correct omegas from hemp oil. So I would increase hemp oil intake before that also. I would be using a hemp oil that has the correct omegas 3, 6, and 9s in it, and is also a long chain triglyceride. That's what I utilize.
Well,
it really comes down to as little processed foods as you possibly can. Consume healthy fats, and
what was that?
Yeah, stay away from shitty sugar and carbs. Like I don't want to sound like a nutritionalist or a health freak, but
no, that
everybody
matters.
Knows that good
that's
food,
important as shit. It's super important.
Yeah, good 100%. Food is good for your body. Period.
Super important.
And it's
is like healthy, like homemade bread so unhealthy?
No, no. And that's the thing. Like it can't certain like bread specifically is if you're going to the store to grab a loaf of bread because you need bread and you can't be inconvenienced to make it without all the enriched bullshit, then you shouldn't consume a lot of it. That's not saying that I don't. I consume fucking bread from the store, but I don't eat a shit. It's not a part
like
of every
processed
meal.
food.
Yeah. The processed shit is
processed.
really where I found that it comes in. Like, and I'm not gluten intolerant, by any means, but I can eat like homemade noodles and bread and not have the same next day effect as if I eat some processed shit from the store. Like, it's so wild to me how I can feel the difference when I wake up the next day. I'm like foggy and cloudy, and I'm like, what the fuck is this? Is this like a weed hangover? I'm like, no, I didn't even hardly smoke that much weed before bed. Like, what is going? And then I'm like, oh, I just ate a shit ton of sugar and had a fuck ton of like shitty bread stuff before I went to bed. That's, if I don't do that, I wake, dude, if I eat a steak, a salad, and like maybe like a juice for like sugar or whatever, fruit for like my sugar, then I wake up the next day like I just did a line of Coke while I was sleeping. Like, I'm just like, let's go, come on. And as long as it's a solid 8 hours, dude, it is so wild how much my energy the next day is affected by what I ate the day before.
Yeah.
And yeah, huge difference.
Fuck, I can't remember the last time I slept 8 hours straight.
Me neither.
It's been years. I bet I don't sleep 2 hours at a time. Even though I might be in bed for 8 hours, but I'm awake every couple hours, definitely.
Takes a very specific diet, exercise, and the right amount of cannabis, bro, and the right kind of cannabis. Like
exercise and diet, priority one, and then a little bit of
just
cannabis.
accepted it and embraced it. I watch a lot of Netflix
exercise
at
and
like
diet
2 in the
comes
morning.
first.
Well, 2 hours sleep is dangerous if you're an epileptic.
Well, I mean, I'm saying like windows of like
In
just keep
chunks.
waking up and rolling over. Like my wife wears a sleep thing and she watches her sleep. She can tell how long she's been in deep sleep and all that shit. There ain't no way I'm laying there with my eyes closed, not awake for more than 3 or 4 hours straight. It ain't happening. I'm waking up.
That's brutal, bro. I couldn't do anything if I did that.
To me too, man.
Well, and that's what it was. We had a little brief glaze over on CBN and CBD really helping in those second, third, fourth stages of sleep where like sleeping medication really fucks you up. And like, so there's a right, kind of going to what Tony said, there's this right combination of cannabinoids that will assess you, gently tuck you into bed and allow you to fall asleep before 4 hours have gone by.
Mm-hmm.
But yeah. With all that said, I got to limit my screen time too as part of my anti-epilepsy trek. And we're pushing 3 hours. So I probably got to dip out of here soon. But this has been I love when we have episodes like this. It gets me excited about learning about cannabis more than what I've already learned. You know, there's always I feel like in everything, even when I did martial arts, like there's this plateau level before you start growing again. And I feel like I've kind of been in this plateau realm because I've been really focused on the cultivation and hash making side. And I'm just starting to get into like the real science behind the medical efficacy of all these cannabinoids. So I love when we have shows like this, even when I don't understand half the words that are being said.
Right.
But
you got a mental workout.
Yeah, absolutely.
The more I understand, the more questions I end up with. I keep coming up with these more variables in the equation that I can't account for.
Yeah, no, it keeps you excited. That's what
I
keeps
wonder,
you.
like when people talk about like combining different isolates to see what entourage effect works the best. Like, do they study how these different isolates chelate together and if they're even available once they mix with each other? They don't. Like some of these things are going to bond together and be inert when they touch.
We're still trying to understand how
they are
work
doing
on our
some of
body
that.
individually.
It's like what you were talking about, Tony, about the
with,
long chain triglycerides. I believe that omega-3 is a building block. I don't think you can even have a long chain triglyceride without omega-3 as part of the molecule. But my memory's fucked. So somebody with a brain would have to look that up. They'd have to take
I only know of one person that studied that so far. There's a doctor that's working with, I think it's medical genomics. They did a test on CBD and CBG together with cancer patients. I think it's breast cancer, and they found that mixing the two together was antagonistic to using
That's what I'm
just
saying.
CBG alone. They were getting better results with CBG by itself than they
He
were
mentioned
with
something
CBG and
about
CBD.
that.
I made a post on my Instagram about it. It's on a reel I did. Because I had brought that up on a show also, and so they were telling me I was full of shit, and I'm like,
how many times have you heard me say mixing or smoking certain weed makes me worse than I would have been if I didn't smoke?
It does. I've learned that from
People
other
will not fucking listen.
Like
they don't fucking
watching patients come into my club that had fucking diseases that I don't fuck with, but because I was interested in their health, like I learned that shit. I don't know all those things. I just know that's a real thing. Like you could give certain cultivars to certain people and it fucked them up. Like I learned that hardcore with my my adopted family, my buddy Cam. He's the oldest person on earth with Dravet syndrome. He was having 300 seizures a day. He went to ACDC, pure CBD. He started having down to 3 seizures a month. And then the company that they were getting the tincture from filled half the bottles with high THC. 12 of the kids overnight ended up in the emergency room, and Cam almost died. All because of a reaction to high THC with their system. And they could not handle it. It almost killed all of them. He started having seizures again over, and they had to rebuild the whole system back up to get him back to his baseline that they had got him to, all because of one bad dosage of cannabis that came with fucking basically 1-to-1 THC to CBD instead of 25-to-1 CBD to THC.
And that's the dangers of that's the dangers of us not being able to know enough. And
it's also like another unpopular thing. Like if you're on SSRIs and shit, you probably shouldn't be smoking a lot of THC.
Nope.
You got a fucking problem that requires you to take SSRIs. You're smoking high fucking THC. You're shooting yourself in the dick and you don't even know it.
Well, and even like I had some friends and their kid had a brain tumor that was like the size of a softball. And they were allowing him to use cannabis during treatment. And so they specifically were like, during chemo, don't use this. During radiation, don't use this. During in between, don't use. So there was like a whole fucking regiment that the doctors for, this cancer patient, this kid, were saying, this is how much RSO of this to give him. And during this time, and this is how much RSO of this to give him during this time. Dude, he's in remission. Like he's about to get his driver's license and shit. Like he came through. So doctors kind of they don't fully know, but there is enough studies out there to guide on the real basic cannabinoids. But I was
given 2 years, 9 years ago.
Like the SSRIs you talk about. If you put someone on CBD and THC fast, high dosage, it increases how effective that medication is in their body and how the body utilizes the medication that they're being given for their disease. So you could totally fuck up how much the body is regulating the medication, if it's time released or any of those things, by introducing CBD and THC for real.
And nothing feeds cancer more than sugar. Sugar feeds it.
Yep.
100%.
Quit eating all forms of sugar, period.
Garbage sugar, like
the first thing you should do. Any kind of processed sugar.
About like Runts and Little Debbie's and Girl Scout cookies and shit. Even though they're my favorite food on earth.
It's like the conversations I have with my daughter who has a ton of cavities. I'm like, I understand that the candy tastes really fucking good, but you got
real good. It. Real good.
I get how good it tastes.
Yeah. Tell her, grown ass 52-year-olds that can't walk past a box of Thin Mints, and they know they're gonna get sick when they finished eating them. They still eat them.
It's tough. It's tough.
It's brutal.
Yeah. I could talk a big game on how I eat, but I eat like shit occasionally, and I know how it's going to make me feel the next day, and I'm like, fuck it. And then I hate myself the next day.
I'm realizing now too, Jeff, like with taking notes and having my little calendar, like on my calendar, a couple of the most important things for me to do are eat protein in the morning and hydrate. Because if I don't eat and hydrate, everything else just goes straight off the fucking rails.
Yeah,
Faster
bro.
than ever.
Yep.
Exercise, big time.
Yep.
You ain't got to do much. You just got to do as much as you can.
Just move. Yep. There's a certain at least for me, there's a certain level of clarity that clicks when I do it, and I'm like, okay, I don't have to worry about this.
Get
for the
out
rest
in
of the
that
day.
garden.
Yeah.
Iron
Yeah.
is correct over there.
That's where I get my exercise.
Oh, and that's just it. Just simply watering your plants is enough movement and interaction that it like will make that
That's what
shit
I tell
click.
myself.
Yep. Yep.
Yeah, there's
Federal patent
well over 300 patents already on.
There's over 600 patents, and China owns over 300 of them
That's
itself.
fucking wild.
If you start to dive in, now they can patent like how you grow the plant and how the process you use to grow to end up with the final product that you're going to utilize could fuck up like
Yeah, for your
everything
SO.
you're doing if you don't. It's
Yeah.
so crazy on the patents they've already got for cannabis, and that all comes into effect once we get rescheduling, and then there's federal trade or universal trade like around the globe with cannabis.
Yeah.
You could start to have those kind of patents being held in court. and
Yeah.
stuff.
Oh, that's gonna
That
be
ain't
wild.
cool. And like Iron Ranger says, I just looked up the info. He's saying there is patents on lipid formulations of cannabinoids as antioxidants and neuroprotectants. Patent 6,630,507 held by the Department of Health and Human Services. So the info that the guy he had on here today, what he's doing, he'd have to figure out a new way, different than the government's way of putting cannabinoids into lipid formulation without it interfering with that patent.
Look, we got Tony rolling too.
Or the delivery mechanism, right?
Yeah, there's already a patent held by by our government for it, for oral, topical, and other methods of administration.
Fuckers. They beat us to it
That's
already.
why learning about big pharma is not a bad thing. You have to learn about the set of rules that the game you're playing is on, and they're not only playing the same rules as us.
They made the rules.
They're the league that we're playing in. Like we can't not
We're
be
now in the
informed
big
about the other
leagues
team. That's like
with
the
no
fucking
prior
the
experience.
Patriots not giving a fuck about the other 7, teams in the fucking league. We're only going to care about what we do, and we don't care about what happens on Sunday and shit. Like that, you have to know who you're playing against and how they play, so you can play the same way. If you want to not lose to them, then
Yeah, right.
we
100%.
should have all been doing this in 1996 in California, and then every state that came in, we should have had a system set up to where they want to join this nonprofit setup where what we have going moves over to you. We don't care where you're from, as long as it's legal and you can be part of it. You should be part of it. But wait until they've already won. That's kind of rough, and
Great.
they're on the precipice of winning everything with cannabis. Like as soon as it's rescheduled to Schedule 3, we can't beat that. You're not coming back from Schedule 3. The prohibition, they changed. They didn't reschedule alcohol. It stayed where it was and all that shit. Rescheduling cannabis into Schedule 3 takes the treaty that they did in 1961 and now makes this a worldwide handled product and a drug that they hold all the patents on. We can't fuck with. That's just how we'll have to fight it then. We got to try to do that beforehand by coming
So we're
together.
on the ropes. We're not knocked out. That's what I heard.
We're not knocked out. That's why I say come together and learn what's going on. And like today, talking with someone that's doing it instead of talking against them. Like back in the day, they'd be mad at someone that wanted to do any kind of pharmaceutical experiments with cannabis because weed's fucking
Highlight J5's comment, Peter. I was going to say something about that earlier. If you know you're going in to get a medical procedure or something like that, fucking lay off cannabis as much as you can before you go in. They can't even hardly get me under.
Yeah, I was saying.
And then they
also
can't
don't
get me
eat
back
food.
awake once they do get me under. I wake up vomiting with people with feet all around me every time I come out of surgery. I've got 15 fucking people around me, and it's a mess. And they're like, we can't get you under. We can't put you down. It's like, and that's because my cannabinoid system's fucking full. nothing to receive it.
That's
So
wild.
how long are you supposed to not use cannabis before you go?
I don't know. Probably as long as you.
I remember when I got my wisdom teeth taken out, in my head I was like, I'm not going to be able to eat for days after this surgery, so I'm going to eat as much food right before I go into it. So I ate a ton of breakfast, go in, they're about to put me under, and they're like, and obviously you haven't eaten anything since yesterday. I was like, fuck no, I ate a ton of food this morning. They're like, oh, we can't put you under. so instead of being out cold while they're ripping all 4 teeth out, I'm wide awake
under local anesthesia. I went through
eyes
the
wide
same
open.
shit.
Yeah,
when I-
and I could feel it, but I had so much shit in my mouth that I was trying to tell them, like, that one hurts because
Ugh.
they didn't put enough.
Yeah.
Anyway.
Not for me.
All right,
I
fellas, how you
learned
about to jump
also
off
don't
of here?
eat. All right, well, yeah, let's wrap it there. Everyone have a good one.
Hell yeah.
Enjoy your, what day are we? Friday? Yes.
Friday.
Friday.
Thanks for having me. Good seeing y'all.
Yeah.
I'm
you
going
too.
into the early afternoon part of my day. I
Yeah.
hope it's enjoyable. All right. Later.
Later, guys.
Have a good one. Later.